Hold on. Sec. Also, I know your plan. It's real nice plan. But we're not playing, okay?
Thank you. Welcome, everyone. This is a meeting of the Public Works and Highways Committee, and I have the following script to read. As Chair of the House Public Works and Highways Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with House Rule 67 and the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. These are presentations pertaining to the capital budget. Please note that there is no physical location for members of the public to observe and listen contemporaneously to this meeting. However, in accordance with the emergency order, I am confirming that all members of the committee and select legislative staff have the ability to communicate contemporaneously during this meeting through the Zoom electronic meeting platform. And the public has access to contemporaneously listen and, if necessary, participate in this meeting by the Zoom platform or by telephone. All necessary access information has been made available in the House calendar and through the electronic calendar on the General Court website. The notice for this meeting complies with House rules and RSA 91-A. Anyone who has a problem accessing the meeting should call 271-3600 or email hcs@leg.state.nh.us. In the event the public is unable to access the meeting will be adjourned and rescheduled. I want to introduce the staff that are on the meeting assisting us: Brad Greenland, Committee Research, and Christopher Shea, LBA. Please note that all votes that are taken during this meeting shall be done by roll call vote. Let us start the meeting by taking a roll call attendance. When each member states their presence, please also state whether there's anyone in the room with you during this meeting, which is required under the right to know law. Mr. Clerk, if we could take the roll. And I would ask, before you do that, I would ask that all members during the course of the day, since we are totally remote, remain muted unless you raise your hand and I give you permission to ask a question or comment. Thank you.
Thank you, Mr. Chair. Representative Graham.
Present at home in Bedford. My wife is in the house somewhere, and I do have a contractor who's doing some work in the house, so there may be some noise.
Representative McConkey.
And good morning, present in my home office. Wife, dogs, and working son may pass through from time to time.
Representative Mills is here. My wife is somewhere in the house with our two cats. Representative Samaro.
I'm here and I'm in my conference room office. Can you hear me?
Yes, sir. Thank you. Representative Fadolfi. Representative Fadolfi. Representative Newton.
I'm here. I'm in Rochester at my house, and my wife is in the house somewhere.
I unmuted. I'm here.
Thank you, Representative Fadolfi. Nice to see you. Are you feeling better? I hope.
Yeah, a little bit.
Representative Blazek.
Here, my 2-year-old is around, and my husband's working in his office upstairs.
Your 2-year-old has an office. Oh.
No, my husband's working upstairs.
Oh, okay.
My 2-year-old is here. She's watching
Okay.
cartoons.
Thank you. Representative Boards. Representative Boards.
I am here, just me and my 156-pound dog.
Oh,
Representative Kaczynski. Representative Kaczynski. Representative Kalansky.
I am here. I'm home with my family. I will be traveling on the road in about an hour and a half here, participating through my hands-free driving.
Representative Thompson.
Present in my office in Colebrook.
Representative Van de Castile. Representative Van de Castile. Representative Cloutier.
Present in my Claremont home, my brother's in another section of my home, but otherwise I'm alone.
Representative Edgar.
Present. I'm at home in Hampton. My wife's in a house someplace, so is CB.
Representative Ebel.
Home alone in New London.
Representative Jack.
Home alone in Nashua.
Representative Abbott.
Yes, I'm home alone in Hinsdale.
Representative Faulkner.
I'm here at home in Swansea. My wife is in the other room.
Representative Newman.
Yes, here in Nashua, and my husband will be in and out of the house.
Representative Eaton. Representative Eaton. Representative Peterson.
Present, home alone in Nashua.
Representative Query.
Present, home alone in Manchester.
Representative Bunker. Representative Bunker. Thank you, Mr. Chair. We have 19 members present.
Thank you, Representative.
Can you hear me now? Trouble unmuting. Representative Bunker present. My wife may pass through from time to time.
Thank you. We have 20 members, Mr. Chair.
Thank you. Our first presentation today is from the Department of Health and Human Services. And I believe the Deputy Commissioner, Lori Weaver, is on. Commissioner, you have other people with you. You can bring them up as needed to explain what is in your capital budget. And
Thank you. Thank you, Representative Graham. Is Chris Shea on the call somewhere? I can't see him, but I need his help to get started.
I am.
The voice from beyond.
Yeah.
Would you be able to bring over Commissioner Goulet and from DOIT and Joe Caristi from New Hampshire Hospital? That will complete our team this morning.
Okay. So Commissioner Goulet. Okay. Yep.
And Joe Caristi.
Yep.
Great. Thank you very much.
This is Representative Jack. I've done those.
Thank you, Representative Jack.
Wonderful. Thank you very much. Good morning, everybody, and thank you for having us. We are here to present our capital budget for the Department of Health and Human Services. My name's Lori Weaver. I'm the Deputy Commissioner. I have with me here Dave Wieters, who is our Information Services Director, who will cover all of our information system items in detail, as well as Dave Clapp and Joe Caristi, who will, be covering our facilities issues. And we have Dennis Goulet, Commissioner Goulet, who's a partner of ours in our efforts with our information system. So we asked him to also be here to help us present today. So if we're ready to get started, I will start our slide deck. Okay, can everybody see that?
yes, it's up.
It's up. Okay, great. Just trying to adjust my participant view. So we basically this morning, as I had just mentioned, we have myself, David Clapp, who's our Director of Facilities, Dave Wieters, Joe Christie, and Lynn Wilsley. We actually have Mary Calise. Chris, you may need to bring Mary Calise over as well. I did not mean to forget you, Mary, as our finance person. That will be a compliment to our presentation.
She should be there already.
All right, wonderful. Okay, so what we'd like to do for you this morning is basically present an overview of each of the components of things that are in our capital budget, as well as some other important items that didn't quite make the governor's budget for both facilities and information technology, and then talk about them in summary at the end for what we're looking at for total dollars. Basically, a high-level overview is we have about 3 new capital projects that are associated with our buildings and repairs and maintenance. We do have a lot of projects that need attention. We prioritized 3 for this biennium. There are 6 others that we would like to ask for consideration for as well for facilities. Whereas with our information services capital projects, we have about 8 major projects for you to hear about today. Critical projects that are essential to continue some of our services that we provide to our most vulnerable populations. And they are pieced and flow together, and Dave Wieters will explain all of those pieces. We also, in addition to the 8, we have about 4 other projects that we would like to bring to your attention as important requests. On the right side is a pie chart in terms of what we're looking at for our federal cost for our capital budget. You'll see it's about 81% of our total cost, whereas the general funds is about 18%. So we do get quite a bit of a federal match for our projects. So our first area to cover is Glencliff Home and some other pieces. And I'm going to invite Dave Clapp to join us speaking to walk us through what is needed here for Glencliff Home.
Hello, this is Dave Clapp, Director of Facilities for Department of Health and Human Services. The Lamont Wing is about 20-year-old addition to the Glencliff facility. The roof on it has deteriorated significantly, and it's actually shown its wear drastically in the past year and a half. So in order to maintain the integrity of the building, we're looking to have that roof replaced. It's a fairly large roof. It's $1.1 million as put into the governor's budget.
Are there any questions before we move to the next slide? Okay, seeing none, I'll go to the next slide.
New Hampshire Hospital seclusion room safety upgrades.
There was a question. Representative Newman.
Yes, thank you. For Director, for Mr. Clapp, on the roof replacement there, I had asked, I'm going back a couple years ago, I just want to make sure that whoever does the roof work is familiar and has seen the site that they're going to be working on, so that there's no surprises when it comes to paying the bills from estimates.
Yes, actually, starting these past couple of projects that we have done, we make it a mandatory that any bidders have to visit the site and review the work to be done.
Thank you.
You're welcome.
Mr. Chairman, can I ask a question?
Who's speaking?
Representative Abbott.
If you could raise your hand, it would help, but go ahead.
Okay. Is this the same wing where I believe it was 2 bienniums ago that they had to replace all the windows?
Yes, it is.
Okay.
Moving on.
The next is New Hampshire Hospital seclusion room safety upgrades. There's been a large change in a lot of the requirements for the hospital. And this is seclusion rooms to ensure that the client does not injure themselves. And it is a fairly substantial upgrade for them. I believe it's 5 different rooms that we're looking at. And it is to put the protections in place to keep the clients from injuring themselves.
Seeing no questions, moving on.
New Hampshire hospital renovations comply with health and safety standards, C and D unit. We're in the process of doing E and F now. These are units that had held youth previously, and they're being brought up to current standards for use by adults. It's, I believe, will include enlarging the, no, not enlarging, but making it capable of handling more adults than what it presently does.
This is Joe Kirsty from New Hampshire Hospital. I just wanted to jump in here. These renovations won't necessarily increase census for the hospital, but the current units are really original to when the building was built, which is about 32 years ago. And so this project would really help us bring the facilities in line with a lot of our regulatory expectations. Joint Commission is our primary regulator, and there's quite a few facility things that they oversee, and these renovations, as Dave mentioned, we're doing one on E and F unit right now. We're hoping to get C and D unit done in this upcoming biennium, really improve the hospital's ability to meet our regulatory standards.
Thanks, Joe. If we're good with questions, I can move to the next slide, Representative Graham.
Go ahead.
Joe, while you're on here, do you want to talk a little bit about just this slide here?
Sure. I just wanted to mention to the committee, so this specific project is actually in the Department of Administrative Services capital budget. The Department of Health and Human Services took over occupancy of the Philbrook building over the summer. We're currently running a transitional housing program out of that building, but it does have persistent sewer issues. So this was just a kind of a plug for from Health and Human Services for this project that is in Department of Administrative Services capital budget. I believe it's a $300,000 project, but there is a sincere need to fix some of the sewer line issues in that building, especially now that we have patients living in that facility.
Any questions on?
No. Representative Fadolfi. Representative Fadolfi, you have a question. You have to unmute.
Unmute.
Your question.
I'm just wondering if these projects you're mentioning so far, are they not in the governor's budget? Are these things outside the budget?
These are in the governor's budget so far.
Okay, now when you come to those things, would you delineate which is which when something's not in the governor's budget so we have a clear understanding?
Sure, yes.
Thank you.
So this, on that note, this slide would conclude what was, this is in the governor's budget for Department of Admin Services. The slides prior to that, which was the C&D unit of New Hampshire Hospital, as well as the wing, Lamont wing, the roof, those are included in the governor's budget, but what we're about to show you past this slide for facilities is not included in the governor's budget.
Commissioner, why don't we hit what is in the budget before we go on to your wish list?
Absolutely. So we did for facilities needs. I have two sections to this presentation. The first half of it is all of our facilities and repair and maintenance, which we just went over. So those items that I just shared with you now for facilities are the only facilities items covered right now in the governor's budget, including the DAS item here. So that would, at this point, anything beyond that would be critical needs that are not included.
And I will give you an opportunity to talk about them later, but first I'd like to go through what the governor has proposed.
Okay, so I will then move on to our information services section of what's included in the governor's budget. And at this point, to do that, and we'll come back, we can come back to what's not included for facilities. Dave Wieters, I'm going to stop sharing so that you can pick up on your information slide. So Dave Wieters is the director of our information services, and he's going to pick up and cover for you what was included in the governor's budget for information services system, starting with our child welfare system. You were good, Dave. I don't know where it went. There you go.
Apologize for that. Thank you, Mr. Chair and members of the committee. My name is David Wieters. I'm the Information Services Director for Health and Human Services. And the next several slides are in the governor's capital budget submittal, and starting with the DCYF, or Division of Children, Youth and Families Comprehensive Child Welfare Information System. One of the things I just wanted to preface, all of these projects, as Deputy Commissioner Lori Weaver indicated, are associated with what we would call lifecycle management and IT modernization. What lifecycle management is over time, systems get old and they stop functioning as effectively as they can. Just like your car or house, you need to maintain them in order to provide better services to our citizens and clients throughout New Hampshire. And all of these systems are legacy systems that are way past their normal lifespan, and we are in either jeopardy of federal funding certifications or other audit findings that has resulted in these capital project submittals. So again, starting with our comprehensive child welfare information system, this system is associated with the federal mandate from the Administration for Children, Youth and Families, or Administration for Children and Families, I apologize. And the current system that we have, which is commonly known as Bridges, is 23 years old. It is on an architecture that was developed back 23 years ago, and it's actually not a common development platform today. So it makes it difficult for us to identify resources to maintain the system, as well as change the system to meet federal and state mandates. Associated with this capital project, we have been working in the past 2 years on the initial intake and assessment components of this system, which allows us to bring people in, assess their needs, and then move it back into the legacy system to do case management, reporting, and then claims processing. This capital project will allow us to move into years 3 and 4 of a 6-year plan to replace the case management component and the reporting functionality. The final years of the 6-year plan, 5 and 6, would be replacing the claims processing solution, which you'll find that we're trying to marry together or braid together with our Medicaid Management Information System strategic plan and looking at a claims solution for the department as a whole. The estimated savings projected for this implementation is estimated at $4 million, and that's associated with the Administration for Children and Families surveys and estimates regarding their new model for a comprehensive child welfare information associated with improved practice, functionality, and processing. Currently, we have our case managers having to maintain the system in multiple different places, as well as manual processes in order to manage their caseload, which is taking taking time away from their very important core competency of providing services to their clients. I'll stop there to ask if anyone has any questions.
Seeing none. Okay.
Okay, thank you. So the next several capital projects are associated with our Medicaid Management Information System. And I wanted to put a slide up here to just give you a background as what is that Medicaid Management Information System and what is the history of that system, so you understand the complexity and the different components that we need to implement associated with the capital project to meet the new strategic directions as well as maintain the life cycle of that program. So that system was designed in 2005 and we contracted through RFP award in 2007. In 2007, we purchased the hardware and software, and that was up until this past year. That was the last time we actually replaced any hardware and software on the system. We went live with the system in 2013 and certified in 2015. Now, certification is an important component for the state of New Hampshire as well as other states, in that when we certify the Medicaid Management Information System, our federal partners increase their federal match from a 50% to a 75% of the maintenance and operations of the system. It takes anywhere from 18 to 24 months to certify these systems, and it's a pretty large dedicated effort to meet all of the standards that our federal partners require of our system. The key benefits of the system that for our organization is and for the citizens of New Hampshire is that 1 in 7 of our New Hampshire residents are taking advantage of, or not taking advantage, or leveraging the MMIS or Medicaid program. And this Medicaid program integrates with all of our common systems. So across the board, it integrates with our Division for Children, Youth, and Family system, our elderly adult care system, our child support system, our eligibility system, as well as our data warehousing environment. It is a key component for our federal claiming and funding match. It actually has 30,000 providers enrolled in the system, and on an annual basis, it is processing $1.8 billion of claims. As a result of many different requirements from our federal partners, we continuously enhance this environment, and the primary penalties that we're seeing this current biennium and we'll see next biennium until we implement is our electronic visit verification system. So in prior bienniums, we did submit the electronic visit verification capital project, which you'll see in a moment, and it was not approved, which has resulted in this fiscal year, we're identifying just under $900,000 in penalties, and it was estimated to cost us $566,000 of general fund to implement. Other penalties and risks is we are implementing the interoperability and patient access final rule this year in the MMIS, which is associated with providing member access to the claims information and the interoperability with other systems. Our component of that is for our fee-for-service claims processing, which is about 6% of the overall claims. The remaining 94% are managed care organization responsibility. And then the final risk we have of not doing these capital projects is associated with the certification. Center for Medicaid and Medicare Services has indicated that we do need to have a solid approved reprocurement strategy and lifecycle management strategy for our Medicaid Management Information System. And if we are unable to update that plan with our 5-year strategy this year, they've indicated that they may need to pull our certification from our system, which would result in an estimated $6.6 million in increased general fund impacts. So going from this slide, we have several projects that are in the governor's recommended budget for capital. And the first one starts with our MMIS lifecycle and reprocurement strategy. So essentially what we have identified is two things. We need to maintain and operate the existing system. And that existing system, given that it has not been maintained and has deferred maintenance over the last 13 years, now 14 years, we have to invest in our servers and our storage and the other technology infrastructure, as well as come up with a 5-year reprocurement strategy to replace that architecture with current functionality to improve our services and reduce our costs. As part of that 5-year reprocurement strategy in this capital project, we have identified the $90 million or 9 million general fund to start with the provider services, call center, care coordination, and system integration components of the Medicaid management system, and then begin to continue on to other modules like our claims processing, which is the core of the system. I'll stop there for a moment to see if there's any questions on the MMIS lifecycle and reprocurement.
I do have one, and it's Representative Graham. You talked about this being a multi-year. What's the risk if future general courts don't approve continuation?
Thank you, Mr. Chair and members of the committee. The risk of not continuing this capital program would require us to maintain and operate the legacy system in conjunction with the new modules. As we implement these new modules, they will interoperate with the existing legacy system so that we would be able to continue processing Medicaid claims. However, we would not be able to realize all of the benefits of a new system until we've completed all of the modules.
Thank you.
Mr. Chairman.
I see no other questions.
Mr. Chairman. Representative Thompson.
I have asked people to use the electronic raising hand. It's the only, I can't see everybody with the slide up. So if you could help me with that, I would appreciate it. Representative Thompson, go ahead.
I don't have a hand showing on my screen for whatever reason. Sorry. On the previous slide you showed us, it showed the procurement of the materials in 2007, and it went live in 2013. It took 6 years to implement this new process with the materials you bought in 2007.
Thank you, Representative Thompson, Mr. Chair. It did take 6 years to implement. There was many different reasons. Some of them were federal mandate changes to the system, as well as the Medicaid Management Information System is the most complex system that we have for the department, and a common implementation across most states is anywhere from 5 to 8 years to implement an MMIS, back when it was what they call a monolithic approach, where you basically, instead of doing modular, which you see at the bottom of the slides, provider services, claims processing, system integrator, instead of breaking them up into pieces, the previous direction from our federal partners was to do it all at once, which required all the integration of those components and all of the project management of all those components to work together and would go live at one point in time. That was the primary reason for the delay for 6-year implementation plan.
Follow up, Mr. Chairman.
Follow up.
So if we give you the $4.6 million you're asking for the current updates, how long will it take to implement those? And if we do this, are we running old software by the time we get it implemented? And you understand what I mean?
Thank you, Representative Thompson. Could you clarify the $4.6 million number for me?
Maybe I'm looking at the wrong one. I'm looking at the governor's budget.
The one we're talking about is 9 million in general funds. It's 10% of the total cost.
Okay, all right, I'm mistaken. But I guess my question is, by the time we get the software and implement it, is it out of date?
That is a very good question, Representative Thompson and Mr. Chair. Pretty much any time in technology, the minute you implement it, it is old. However, the newer technology, new strategy of modular procurement, along with some more technical components of how it works, is leveraging, I would say, maybe Commissioner Goulet could help me with this conversation, but however, it would say it will be deprecated, however, it will be on current development platforms, and so that we can continue to scale and sustain the system. Whereas right now, the current solution that it's running on is 7 versions old of Oracle and IBM products, which is no longer supported by our vendors. We would be on the current version of all of those supported products, as well as the current hardware. So our vendors would continue to support the system, which is a key component of certification with the CMS, as well as when we update to the current, what normally happens with most of our vendors is they support what it's called a N-1 or N-2 current version -2 versions. So they'll let us continue to support that for a 5 to 10 year period.
Okay, thank you very much.
Representative Ebel.
Yes, thank you. And thank you, Mr. Wieters, for being here. I think you know we have a copy of the governor's budget, and then we have a copy of your requests. And so I'm just trying to align what I see in the budget to your requests. I see the MMIS lifecycle management is 35 million. That was your priority 5. I see a total, maybe you're getting to this, and if you are, I can just hold up. But I see your total request is 90 million. So maybe some of your priorities are aggregated in that number.
That's a very good question, Representative Ebel and Mr. Chair. Our original request was for 35 million for the lifecycle management of this solution. And that 35 million will essentially take all of that Oracle and IBM along with several other software vendors and update them to current technology, as well as upgrade the hardware to the current technology so that we would be able to maintain it for the next 5 years, while we are also doing a reprocurement strategy. So subsequent to our request, we met with the governor and addressed our MMIS strategic plan for reprocurement over the next 5 years. And he added to his recommended capital budget the additional 55 million so that we can start on that reprocurement strategy, so that we're not here next biennium asking for another extension of lifecycle management on a legacy system. So the idea there is that at some point in time, you in IT, you look at a system and say, is it old enough to be replaced? And you look at that and balance it. Say, how much does it cost to maintain and operate the current system? And what are the impacts to the customers, or in this case, the clients and the citizens, as a result of that older technology? We've identified a 10-year life cycle for most of these large systems to get a return on the investment, as well as indicate, say, we're going to leverage the technology for 10 years and then replace it with the current technology so that we could use it for another 10 years. So that not only do we improve the processes internally for our staff, we also improve the services that we're providing, both from a self-service perspective, leveraging newer technologies like text messaging to people having web apps that are on their phones, as opposed to having to go to a web page on a computer. Those are some of the nuances of newer technology that weren't available back in 2007. So that's what that additional 55 million or 5.5 million in general funds would fund. And we were planning to start that with our provider services component, our call center component, our care coordination component, and system integrator, as well as you'll see other capital projects in the next several slides to address some other components of the MMIS, to include our federal reporting and our electronic visit verification.
I would point out that right now, the committee is focused on what the governor has proposed, whether we keep that. And then in our work sessions and executive sessions, we will look at any additional requests that may or may not be able to be funded in the current biennium. So I need the committee and the department as they present to keep that in mind so that we are not getting confused with, we want an extra 5 million and assume that it is part of the governor's budget.
Thank you, Mr. Chair. To clarify, this MMIS lifecycle management and reprocurement is in the governor's budget, the full 90 million, and it is item number 8 on the PDF document that he submitted.
Okay, moving on.
So the next project associated with the Medicaid Management Information System is our Federal Reporting Integrity and Compliance capital project. Again, this is part of the governor's recommended budget, and this is key to maintaining our federal match associated with updating our CMS 64 report, which is our report that is used for submittals for federal financial participation. And that is the key report that we need to submit quarterly on time in order to continue our federal matching funds. Additionally, it's going to address our current issues associated with claims adjudication for encounter claims, as well as our pharmacy benefits management reporting, our TMSIS reporting, and then as we implement the electronic visit verification system, it will need to integrate into our federal reporting strategy. It would integrate here as well. This platform has been implemented over the last several years, and we continue to grow and expand it. So this particular project is not a 90% federally funded project as a result of our goal to have one single enterprise business intelligence platform where we bring our data together to be able to effectively not duplicate efforts across our different divisions. This will reduce our costs overall, as if we did it the original direction, we would have 7 or 8 of these different platforms and implement these 7 or 8 different times on different systems. That integration is planned to bring in our behavioral health system, our New Hampshire hospital data into the system, which has already begun, as well as continue the integration between our children, youth, and families, our eligibility system, child support services, and long-term supports and services. It also will continue to enhance and extend the system to support the master client index, which enables us to basically leverage the economies of scale of one system and connect to it from our various case management systems within our different divisions within our department. And then the final component here in enhance and extend is our data governance or metadata management and data management, which is important to adhere to federal and state privacy and security rules to ensure that we are sharing the data with people that need to have access to the data, and that we're able to log who has had access to it and report on that information as well as continue the data integrity, which means keeping it consistent and accurate for when we report the data out. I'll stop there to see if there's any questions on this.
Seeing none?
And then we have our electronic visit verification system. And again, as I stated earlier in the testimony, this is associated with a federal mandate. It is the 21st Century Cures Act, which was signed into law in December of 2016. Originally, it was required for all states to have this implemented by January 1st, 2020. However, many states, including our own, requested for a good faith effort exemption to January 1st, 2021, hoping that we would identify the funds to be able to implement it prior to that deadline. Unfortunately, we were unable to identify those funds through either capital submissions or operating submissions, and we were unable to implement that system by January 1st, 2021. The Center for Medicaid and Medicare Services has indicated that they will be imposing a penalty on our personal care services initially for the fiscal year 2021 and in future fiscal years in the amount of 0.25% in 2021, which equates to about $860,000 for this biennium, and then it will increase over time to include the home health service penalties if we continue to not implement an electronic visit verification system. This system is gold at reducing fraud and being able to post-payment recoupment, but basically identify what's happening. So what it will do from a process, as you see on the right of this slide, is the provider arrives at a client home. They electronically check in to say that they're actually at the home in the residence. It will do a GPS verification that they are there. They provide the services, they record the services, and then the visits are basically confirmed prior to billing. And this will help reduce fraud and automate that process. Most states, not all states, but most states have implemented this system. We will be one of very few that have not at this point. Our funding request for this amounts to a $566,000 general funds, which I just want to note that that general fund impact is less than what our penalties will be if this capital project is not approved. Any questions on this?
I do have a couple of questions. When you were talking about fiscal years, you were talking federal fiscal years. For example, we're almost halfway through the federal fiscal 21. So no matter what we do, we're going to pay that for this year.
Thank you, Mr. Chair. You are correct. We are paying an $894,000 or $864,000 penalty, estimated penalty this fiscal year. And then next fiscal year or 2022, we anticipate that penalty to be 1.3 million. And that would be our state fiscal year's penalties, not the federal fiscal year penalties.
And if we being the general court and the governor approve this in the capital budget, will we be able to get an exemption for the following fiscal year because we've shown good faith effort that we will be implementing this program?
Thank you, Mr. Chair. That is correct. Actually, the way the Center for Medicaid and Medicare Services will be effectuating the penalty is on a quarterly basis. So if we are able to implement the electronic visit verification system by April of 2022, which is our goal date at this point, if we were approved starting in July 1 to move on the project, then we would not be penalized for future quarters. And so it would reduce our penalties in the next biennium.
Thank you.
And the last project associated with the Medicaid Management Information System specifically is our beneficiary service improvement. And this again is part of the governor's budget recommendation. And this specific one will address many different components. So as we go to reprocure a system, we are required to have an independent verification validation contract, which is essentially a third-party contract to review and report on the activities that we implement in the Medicaid Management Information System. And that report goes to the Center for Medicaid and Medicare Services, essentially is an audit of all of our activities for enhancements to the system, and it's required for us to have in order to continue a reprocurement effort. Additionally, we would be implementing updated third-party liability claims for fraud and fraud detection system that we're working with our division to address that from a quality assurance and a program integrity perspective. The other components of this would be to improve self-service functionality, as well as maintain our federal financial participation funding to keep our system in compliance. There's several different components of this Medicaid system that require updates. And this is why we actually pulled them into several different capital projects to associate them specifically to those components. And then you'll see that we have a few other items listed at the top here, and then some other functionality that we've been trying to implement associated with the Medicaid system to manage nursing facility cost reporting, as well as nursing facility cost analysis to support our rate setting. Is there any questions on this project, which is estimated at $800,000 in general funds, and will have a 90% federal match for a total funds of $8 million?
Representative Abbott.
Thank you, Mr. Chairman. Could you tell me, in your conversations with the governor, in his budget proposal, this is his number one concern? Well, if you're 11, can you tell me why the discrepancy?
I apologize, Representative Abbott. I couldn't hear your full question.
I'm
Could you
just
repeat it?
asking why the governor in his budget has this as the number one priority, and in your request, it's the 11th.
Dave,
Thank you. Oh, okay.
Yeah, thank you for the question, Representative Abbott. The items on the governor's budget are not in a priority order. They were just in there as listed.
I believe they're actually in alphabetical order.
They are in alphabetical order in the governor.
Okay, thank you.
We will show a slide at the end which shows our priority order for the items.
Am I okay to move forward, Representative Graham?
Go ahead.
So moving away from Medicaid management information system capital projects, now this specific project, also in the governor's submittal, is what we call what is called the minimal acceptable risk of security and privacy controls for exchanges, or MARS-E is what we call it. It is a requirement from our federal partners for us to have this audit of our integrated eligibility system, which is as it states in the name, integrated with our MMIS, but it is not directly a Medicaid Medicaid management information system component. It is a separate system. It is our second largest system that DHHS runs. And in order to maintain that, we have a requirement to do this audit every 2 years, which takes an estimated 12 months to complete. We outsource the funds, we outsource the solution to our partners to be able to work with us to complete this audit and this assessment and remediation. And the reason why we do that is not only do we do the assessment, but we actually have to remediate the issues prior to submittal to the Center for Medicaid and Medicare Services. This allows us to retain our 75% matching dollars for the maintenance and operations of the integrated eligibility system, also called New Heights. And the funds requested here is estimated $600,000. We have completed these several times in the past, and the general fund expenditure for this is $60,000. Any questions on the MARS-E?
Seeing none.
This next project, the Developmental Services Information Technology Remediation Project, which members of the House Division 3 will hear more about in the long-term supports and services presentation on Monday, is associated with the Long-Term Supports and Services Bureau of Developmental Services, and directly is a result to a 2016 LBA audit finding. And what they found is that the system was unable to meet the requirements that we have both at the state and the federal levels, and that we need to update the system from the current process, which is on a legacy, I would say, spreadsheet and access database environment, into a modernized version of a web-based information system to address those federal and state regulations. We did begin this work with an existing capital project, and we have been working in conjunction with the integrated eligibility team and its system, and leveraging components from that, as well as this next phase will leverage the work accomplished on the Division for Children, Youth, and Families comprehensive child welfare information system, using the Salesforce platform to continue that work. And instead of duplicating the effort, we are able to leverage that platform forward and continue to use that platform to reduce our overall costs. I'm going to go ahead and stop there on this one, but from a funding perspective, this is again anticipated to be funded by our Center for Medicare and Medicaid Services federal partners at 90%. And our general fund impact would be $1,327,833. This one has a very specific number as a result of us working with a third-party vendor to do an assessment of the system and provide us a scope of work of how we can move forward. And we have very good anticipation of what this one will cost to implement, and the timeline to implement is within the next biennium.
Seeing no questions.
And then we have also in the long-term supports and services group, we have a capital project requesting funding to replace the Bureau for Developmental Services direct billing solution, another access database system that has continuously, unfortunately, failed in the past, requiring a lot of effort from our Department of Information Technology partners to support us in our time of need to continue this system forward. And it's a direct association with our corrective action plan that was provided to us that needs to be implemented in order to maintain our federal funding for services that we currently have that federal funding at $181 million. This system has objectives to basically work with the MMIS and make changes to that system, which would be included in the MMIS lifecycle and reprocurement strategy, but also update its billing processes, update the service authorization components with the area agencies that they support and coordinate with, as well as eliminate manual processes that are currently ending in error and requiring duplicate effort, as well as inaccurate reporting. The funds associated with this is $100,000 in general funds and with a $900,000 federal funding match. Any questions on the BDS direct billing?
Seeing none, thank you. That's the last of what is currently in House Bill 25. Commissioner, you want to continue on with the information technology and then go back to the facilities as long as we're on a roll on IT. I will mention that other agencies have come in with multiple additional requests, and the fact that we are limited in what we can give. Right now, the requests total almost as much as what the governor has proposed. So, and we haven't heard from the university or the community college system. So we will listen.
We surely do understand your challenge. I can appreciate it. I agree, Representative Graham, that it makes sense to continue on with the additional requests for information services, and then we can hop back to the facilities. So Dave, if you want to walk us through that.
Especially since we're tied up Commissioner Goulet as well.
So the other important information technology requests that we had submitted that did not make it onto the governor's budget recommendation. The first one here is associated with our Bureau of Elderly and Adult Services system modernization. It would be continuing to evolve that system, which is a 23-year-old system. And it needs to be updated to a web-based service and be accessible externally. It currently isn't externally accessible, requiring us to basically do reports, send the data out to our external partners, and then have them provide the data back to us so that we can incorporate into the system. This system is used to manage the Elderly and Adult Services Bureau social worker caseloads and the Adult Protection Program service authorization provider payments related to that social services block grant. Over the last 10 years, the Bureau's model has evolved to include a higher percentage of field work by social workers, and we subcontract with ServiceLink personnel and contracted agencies to do this work, and not having a system that is accessible off-site has resulted in duplicate work where they're actually doing a manual process for their case notes and case information, and then having to go back to the state network to upload that data into the system and then report on that from a perspective of what we need to do with the case management notes. Without the upgrade, the new business practices will not be able to be supported, and additional personnel in order to maintain the work would need to be identified to continue to actually meet the demand for the caseloads. The estimated funding on this is 2.7 million and change for federal funds, and it was a larger majority of general funds of $4 million and change. And then this second one on this slide is interoperability and integration. We, as part of the CARES Act, we began an implementation of a closed loop referral system to improve our care coordination to our services throughout the state. That closed loop referral system is goaled at integrating our community-based organizations, our community mental health centers, our federally qualified health centers, hospitals, as well as our education and juvenile justice systems, and then migrating into our managed care organizations so that when you have a referral for services, no matter where you're at, you can get a referral through informed consent in a HIPAA compliant environment so that we can actually provide improved and faster services to our individuals, as opposed to the current manual processes resulting in a delay of those services. And as well as, in addition to this, the New Hampshire Hospital was, along with Department of Health and Human Services, was looking for a time tracking and scheduling system. And specifically for New Hampshire Hospital, we were looking at acute care time tracking, which is a very specific need that is not met by the current time tracking system allowed at the state level. And the funding for this was identified as a 33% match for general funds at 2.6 million, 2.6 million and change. Is there any questions on these two projects?
Representative Newman.
Yes, thank you. For the department priority number 13, for bullet number 4, how many additional personnel is estimated could be required if you don't have an upgrade? Any idea?
What I will do, Representative Newman, is I will reach back out to our division director and identify what those numbers are and make sure I have that answer for you.
All right.
I would ask that you reach out soon, like by next Wednesday.
Thank you, Representative Graham. Mr. Chair, I will certainly have that update by next Wednesday. I would anticipate having it to you by Monday.
Provide it to Mr. Shea so that he can get it out to everybody.
Absolutely. Thank you, Mr. Chair. And the last two important IT requests.
I got Representative Ebel.
Well, I can wait until he's done, but and this is backtracking a little bit. Am I right that the BDS, that direct billing that was included in the governor's budget, wasn't on your priority list, or maybe it's just not in the book that we have.
I will need to check that, but I believe the BDS direct billing should have been on our priority list.
Yeah. It probably, excuse me, it probably was, but we only have 1 through 11. So, and
Okay, I will validate that and have that answer to Mr. Shea as well.
Thank you.
On Monday.
Mr. Shea, you had a comment?
Thank you, Representative Graham. So back in June, when the governor's capital budget hearings occurred, that was on their priority list. That BDS direct billing was project number 5. It did not make it into the capital improvement book that you all have, the blue book, where you see the 11 projects listed that the governor had further work done on with the Bureau of Public Works, or DOIT. So in fact, the Health and Human Services had a total of 25 projects that they requested back in June. And there was a document that I sent to you several weeks ago, which was a summary document of all those requests. And I can resend that to the committee today if they need that.
I'd be happy to have it. Thank you.
Yep,
I would too. Yeah.
I'll resend it then.
Yeah. Thank you, Mr. Shea. Representative Abbott.
Yes, I'm showing that as number 11 in the government budget. Bureau of Developmental Service direct billing.
I think that we covered that it is there, and that these are in the governor's budget just alphabetically and not prioritized by the department or the governor.
Yeah, but it is there.
That's correct.
Seeing no other questions on these two? Okay.
Okay. Thank you, Mr. Chair. The last 2 projects that we have are surrounding public health requests for their ability to do lead poisoning prevention, as well as analyze water for PFAS specifically. So this first one, environmental health data system, is to request 3 antiquated homemade access databases and 5 linked Excel spreadsheets that have caused some challenges with data integrity and accuracy, and replace it with a comprehensive environmental health data system that will take care of the data management and storage associated with Healthy Homes and Lead Poisoning Prevention Program. So this current program is running on those Access and Excel spreadsheets, and it's really outgrown that homegrown system. And we are estimating a $250,000 investment in a web-based application would bring us into a system that not only has the ability to meet the lead poisoning prevention program, but also address the current data accuracy and integrity components of that system. And then this last one, the PFAS environmental water testing equipment, is a request to purchase a liquid chromatograph and mass spectrometry system for water testing and minor renovation. This and minor renovation to the public health lab space. So to allow for that testing. The purchase of the instrument and this renovation will allow the New Hampshire Public Health Labs to effectively test environmental samples, specifically water for PFAS.
I have a question about that last one. Last year, the legislature approved $50 million for PFAS remediation. Can you not tap into that for $430,000?
I will seek to see if we can do that, Representative Graham.
Thank you. I would hate to duplicate efforts since that 50 million is hanging out there.
And that would bring me to the end of the information technology additional requests. So I would pass this back to you.
I have another question from Representative Ebel.
Thank you. So if I read that priority number 25 correctly, who's doing the testing now? Or is there a lot of it being outsourced, or how is that working?
Currently, if the public health lab was requested to do the testing, they would need to outsource it to a third party and pay for that to be done elsewhere. I believe maybe Commissioner Goulet, do you have additional information on that? Or Deputy Commissioner Lori Weaver? What I can do is I will also research that to get it.
I can't hear him. I don't have any additional information. I don't know if you do, Commissioner Goulet.
What I will do, Representative Ebel, is I will follow up with our public health labs and validate my statement and also address that to Mr. Shea as well.
Thank you. Commissioner Weaver, shall we go back to facilities?
Sure. So Dave, do you want to stop sharing your screen unless you want to scroll back? Nope. Okay.
Sorry,
That's okay. So you will see that we have these other items as 25. So as was mentioned, we submitted in June 25 items for approval, and we received approval on 11. So the other items are what we're sharing with you this morning. So we left off here at the Philbrook site. I'm going to ask Dave Clapp to come back to us to talk about, these were priorities 9, 10, and 15 in our list that didn't get approved by the governor's budget, but do have requests to be considered.
If, as you go through, we have several new members, so if you could at least talk about where these facilities are, would be helpful.
Sure. Dave,
Sure.
are you on the line? There you
Yes,
go.
I am. The priority number 9 that we had was SYSC bond roof replacement. That's at the Sununu Youth Center, the old YDC property. These are the external buildings to the SYSC, the Sununu Center itself, that were used for support, and they are still used for some support now, storage, and some programs. The bond roof is well past its useful life. It has been leaking for a number of years, and we've been trying to get this replaced at least 4 years that I know of. It is actually to the point that the water is migrating interior to the building and will be starting to cause structural damage to the bond if it is not taken care of soon. We are requesting $325,000, all of that general funds, for the repair and replacement of the roof. The next priority, number 10, is again the bond boiler replacement. This boiler handles, again, is at the SYSC Sununu Youth Center, and handles all the external buildings from the actual youth center itself. There's, I believe, 8 buildings that receive heating from the boiler at the bond. It had a problem with a power fluctuation, shut down and froze, and is no longer serviceable. The next is at the Glencliff home up in Benton, New Hampshire. This is the same location that we're looking at the roof for the Lamont building. The Glencliff wastewater treatment site has its own wastewater treatment system. The system is failed. We are in getting close to having violations from DES for groundwater contamination because of it. So it is a priority as far as we're concerned in trying to get that addressed.
And just as I said, we have several new members on the committee. What is Glencliff, just so that people know?
Glencliff is a facility that was originally used for tuberculosis, has been turned more into a nursing home for people with acute issues as far as let me see, Alzheimer's and so forth.
Thank you.
Any questions on any of these three items?
Yeah, I have one.
Representative Newman?
Yes, thank you. Going back to Glencliff, if the system is determined to be failed right now, how long reasonably is it before there are going to be citations and penalties and whatever? How long does that take?
That's a good question. We're working to maintain the system and keep it from getting to the point of being penalized by DES on that. We are not at that point yet, but I don't know how long we can continue to do it. Okay. It could be a year, it could be 4 years. We're working to try to maintain it and keep it in a moving forward fashion.
All right, thank you.
You're welcome.
Representative Thompson. Representative Thompson, you need to unmute to ask.
With respect to the wastewater system, what type of system is there currently?
It's called a field bed system. It's a buildup of sand as a filter medium. And over the years, the filter medium does build up with solids, and we do treat for that. And that's where we're at now. It's the bed has broken down to the point that it's requiring a lot more service to maintain it and keep it operational.
Follow up, Mr. Chairman.
Follow up.
What are you going to try to replace it with? Must have something in mind if you've got a $1.2 million figure.
Yes, what we're looking at doing is replacing the full sand bed, the receiving system coming from the facility, the treatment tank, the pre-treatment tank before it goes into the field.
Okay, thank you very much. Thank you, Mr.
Welcome.
Chairman.
Representative Ebel.
Thank you, Mr. Chair. Mr. Clapp, recognizing that we have constraints on what we can budget, is there a way that we could help with this by perhaps appropriating a little more? Do you need engineering money? I know you want it all, but is there a halfway house in any way here? We visited the place. I have some sense of it.
Yeah, it's hard to say. I mean, that cost is an all-in cost for engineering and so forth. We have had it looked at multiple times, and it does get inspected by DES on a regular basis. We're working to try to keep it functioning as long as we can. That's the best I can say. I mean, it really needs a full replacement.
Thank you.
Seeing no other questions on those?
And I think for the next two, I'd like if Joe Christie could speak to the next two.
Sure. So again, I'm Joe Caristi, the CFO for New Hampshire Hospital. For priority number 16, New Hampshire Hospital security system upgrades. So this is a project aimed at trying to improve staff and patient safety on the units. We currently have multiple units in the hospital, and each one of the units has its own unique security system bought at a different point in time. All of those systems are quite outdated. We actually had one fail this past year, and we couldn't find parts, so we had to replace the entire system. So this would help replace a lot of our camera and surveillance equipment throughout the building, and then also include a new communication technology for staff. So the hospital, on an annual basis, we have about, I'm looking at our statement of appropriation real quick here. We have $970,000 a year budgeted for workers' compensation claims. This is really an attempt to try to help reduce some of those employee-related injuries who might be at the end of a hallway, no great way to communicate to their peers. This type of system would allow us to increase communication up and down our corridors for staff and patient safety. So that's priority number 16. Any questions on that one?
Seeing none.
Okay. Priority number 17, New Hampshire Hospital flooring upgrades. So again, New Hampshire Hospital was built in 1989. A lot of our furnishings are still original to that date. Additionally, we have a fairly extensive amount of carpet in the building, which really is not great from an infection control standard perspective. And regulations are increasingly going more towards not allowing carpets or other types of foamite surfaces to be inside a healthcare facility. We do anticipate that will also be further pushed now that the COVID-19 pandemic has happened. Fortunately, in this past year, we have been able, or we hope to be able to use some COVID-19 money the hospital received to replace some of our flooring. And so this would be just the remaining portion of that.
Seeing no questions?
Great. And the last one we have here is the demolition of the Wilkins building. I think Dave is still on the line.
Yes. The Wilkins building is located on the Sununu campus down in Manchester. The building suffered a catastrophic fire about 6 years ago and has been deemed structurally reduced. So in working with Public Works and the State Historical, they have agreed to allow us to have that taken down. The building is in extreme disrepair and it's unstable. There are sections of the building that could collapse. We have cordoned off the area, but we do get local youth that violate that fencing and do get into the area. We try to keep them away from there as much as possible, and that's why we're calling it a safety issue. We do not want to see anybody from the area getting injured.
Seeing no questions on that. Commissioner, I have an overall question on the last two slides.
Sure,
if we were to begin to look at funding anything additional in your facilities requests, these are the priorities that you would want them to be in?
Yep, I'm just trying to catch up with you there. My computer's moving very slowly.
It starts with the barn roof replacement. And
yes, so this slide here, so the prior slide to that is I think it was asked prior about the order. It is, you'll notice it is different than the order of the governor's budget. This is our priority for the 11 that the governor has approved. And the very last slide here would be the other important requests. And I do not believe that, I'm not sure if these are, Mary, or do you know if Mary Calise, if you're still on the line, if these are in priority order?
I do not know that they are or are not in order of priority.
Okay.
Commissioner, I would ask that you redo that slide and send it to the committee in priority order, so that we can see if there are any additional funds available, what we could or could not fit into it, rather than us looking at this list going, oh, I like number 9 or not. Number 9, you didn't even talk about, really.
Correct.
So
I can absolutely do that for you. I will make sure that that is in a priority order and then send it over to Chris.
and on your very first slides, you showed a breakout of general fund versus federal funding, how we leverage that, but you were at the 145 million figure with that pie chart. Could you send us one, or send me one at least, that shows it at what the governor has proposed, in case you don't get any more money?
Certainly.
Thank you. And I think that with several people, at least one on here, would like to ask a question while we have all of your staff there about the proposal for the forensic psychiatric hospital that is contained in 2 different bills and 2 different bodies of the general court.
Sure. Yes, I understand there was a little bit of confusion about the difference between the number of beds. What is that correct? That what you're referencing?
That is correct. One I believe says 25, House Bill 2 says 60.
60, correct. So last biennium, this was obviously something that was a big discussion and was put into the budget. We were required to do an assessment and look at what the current need is. And at that time, we assessed the need at 60 beds. What was funded in the budget was 25 beds. So that is the difference between where we were at 2 years ago and what got funded. So we now have that discrepancy. It is the intention to build out a facility that will ultimately be able to eventually house 60. So there's the intention to build a facility that will house 25, have 25 beds, potentially the first floor, and then to keep the infrastructure to build potentially a second floor where we could fill the remainder of those beds, getting to 60, but not fill them right now because we won't have the money to do the full build on that, but we will have the money to do the full build on the first floor for the 25.
I would suggest you look very strongly at that. In the future, build another floor. I know that another agency has been talking about building a 3rd floor onto their facility for many years, and we still haven't got around to it. So just look at, if you get the money in House Bill 2 sufficient to do the complete building, or is it only for the 25 beds?
That is what we're in the process of revisiting since 2 years has gone by, and we're working with DAS and Public Works to look at the money that's appropriated on the 25. Does the 25, it's ultimately, we have 8 million in this budget right now, and the 17.2, the 17.25 in HB2 would be the 25 million for the 25 beds, or how much further beyond that can we go? HB2 does allow us to bond out and borrow money if we need to do that extension, to be able to do that build if we don't have enough money.
And yes, we know that there is the potential to bond that. It raised some concern among the members of the committee that this committee was not involved in any of those discussions. Just so that you know, I have asked finance as they go through House Bill to provide a an amendment to that that would require your department to report to the Capital Budget Overview Committee on the progress of that project, regardless of the fund source.
Okay. Thank you for that heads up. Any other questions that you have on capital?
I have a question from Representative Fidolfi.
Unmute down there. There, I found it. I was just curious if there's, with all these technological advances in the systems, is it going to require a net increase or a net decrease in personnel in the budget?
That's a really good question. Thank you for the question. And Dave, I'll turn that over to you first.
Thank you for the question, Representative and Mr. Chair. Most of the technological advances are actually goaled at keeping the current staff as it is. However, like in the MMIS group, we have been running 6 vacant positions to support that system, and which has resulted in a delay in actually being able to enhance those systems. And additionally, with all the additional projects for the Medicaid Management Information System, we are seeking additional positions for that. I think it's 2 positions that we're looking for that in funding to manage those projects. Once those projects are over, they would be able to maintain the existing systems as it goes forward. But to be more clear, the technology is goaled at taking manual processes and not overburdening our existing staff and addressing some of the delays that we've resulted in those manual processes so that we do not have to add additional staffing. Commissioner Weaver, or Deputy Commissioner Weaver, did you have anything else to add?
Nope, I think you answered that. Thank you.
Representative Thompson. You have to unmute, Dennis.
Okay, sorry. Mr. Wieters, I guess my question is, back to the IT issues and the penalties that we've been assessed by the federal government. Do you have a total of what those penalties amount to? I guess it would begin at the beginning of the last biennium up to current.
Certainly, Representative Thompson, Mr. Chair. The current penalties are actually associated with electronic visit verification. They have not been enacted on us yet. So we anticipate seeing that first penalty at the end of this month from our federal partners. And then every quarter after that, we would see those penalties. So that $860,000 of estimated penalties would be quarterly. So one for January through March of this fiscal year, one through April through June, and then continuing every quarter after that. There are no other penalties that we've seen. What we have been indicated by our Center for Medicare and Medicaid Services is that what's called an advanced planning document. It's the document that we need to submit to CMS to indicate what we're doing with our MMIS. That expires, the federal funding for that system expires June 30th, and we have to resubmit a document showing how we're funding the lifecycle management as well as the reprocurement strategy for the system by June 30th with our approved strategy in order to maintain our certification of that system. So those, again, would be future biennium, next biennium penalties if they enact those penalties on us.
Follow up, Mr. Chairman.
Follow up.
In the beginning of your presentation, you referenced the $900,000 penalty that may have already been assessed?
Thank you, Representative
I
Thompson.
apologize, I didn't take any.
So I may have misspoken. What I'm indicating is that we are already non-compliant with electronic visit verification for the months of January, February, and now beginning of March. And until such time that we implement an electronic visit verification, we will be penalized at that 0.25% for this federal fiscal year, and then it will go up to 1% of our personal care services costs, which we estimated for this fiscal year at $864,000. And it may be more or less depending on our final reports to them. And so when I indicated about a $900,000 penalty, that's what we're anticipating for this fiscal year, regardless if we get the funding for this capital project. At this time, we would not be able to implement electronic visit verification system to meet that January 1st, 2021 deadline to avoid that penalty.
I apologize, as I took my notes, I wrote the 900,000 down and then the 864 under it. I didn't know they were the same figure roughly.
They are
Appreciate it.
roughly the same figure, Representative.
Thank you very much.
Representative Ebel.
Thank you. I'd like to go back to the SPU just to understand a little bit better. So, so the total amount that you're anticipating the building will be is 25 million. So there's 8 million roughly that was appropriated last year, I guess, that was carried over. That's my understanding. And now what's in HB2 is 7.25 million. And it's anticipated that a decent hunk of that is going to come out of Fed funds. I wondered if you could talk about the federal fund aspect of it, because to the extent that it's not covered by federal funds, I think we'll be looking increasingly at our bonding capacity for it. So since we're the bonding geeks here, any enlightenment you could share would be great.
I may need to turn to Joe Caristi in terms of the federal. I'm not, in terms of the billing and how we would do that or for the patients, I'm really not clear on that. I know that for the building, we were appropriated a set amount of money. We asked for a certain amount. We got budgeted the 25 to build with the 25. But in terms of the future and the federal, Joe might be able to better address that than I could.
Sure. I think that is a question that I might have to connect with a few folks within HHS and try to get you an answer back. In terms of billing for the facility, it's dependent upon kind of final design and so forth as to whether or not it kind of meets a certain level of standard that can be billed for. So I don't have a great answer for that, but we can certainly connect amongst the department and send some or submit something to Mr. Shea for the committee.
Follow up, Mr. Chair.
Follow up. I just want to say whatever you prepare for us, I am sure that finance will be asking the same questions.
Right. I mean, that's basically what I was going to say. I think this is probably an evolving discussion. And so, you know, I think based on what the chair said as well, if you could keep us apprised, because things end up getting put in the capital budget that we aren't really weighing in on that much, and we just really are responsible for overseeing it. My other question is simpler. Where are you planning to build this?
The magic location. At the time that we were looking at 2 years ago was here in Concord on the State Office Park South Campus, which is pretty approximately across from New Hampshire Hospital, the abutment of this between the property that abuts Clinton Street and Fruit Street. So it would be adjacent to the Philbrook building, and depending on where you're standing, in front of or behind the New Hampshire Hospital. That is about the only piece of property that left on this campus that we would have any space to build. And as you know, there's the restrictions in this campus in terms of the historical buildings and restrictions. It is pretty much that corner.
Representative Jack.
Thank you, Mr. Chairman. Mr. Wieters, I was surprised to see the number of times that the words access database appeared in the slide deck. If you're like me, you know what year that came out. Do we have other systems that you didn't call out in the slide deck that are that old?
Thank you, Representative Jack. Definitely, we have several access databases. It's too numerous to count. Managing different systems. These are the critical systems that we submitted. So we definitely have lots of projects that we could submit. What we did is we submitted our priority and most critical items that are addressing the services directly right now. And what we're trying to do is with these bigger platforms is replace multiple access databases that are doing many specific, or what I call a point solution, and make it so that we can have a team of people doing many different services with one platform. So that what these capital projects will do is move a lot of those access databases that we didn't actually mention every single one into these platforms and continue to grow away from Access and Excel as being a systems approach, which was the current process due to lack of funding for these bigger system platforms.
Thank you.
Seeing no other hands raised, Commissioner, do you have anything final you would like to say?
I would like to say thank you to all of you for your time and attention and excellent questions regarding our capital budget. And I will follow up with Mr. Shea on all of the items today. Thank you for having us.
Commissioner, thank you and your staff for being here answering. Commissioner Goulet, thank you for joining us because there is a big chunk of IT in this. So it's always nice to know that you're in there with them as a partner in all of this. With that, our next presentation is not until 11:30. The committee will stand in recess until 11:30 when we will hear from Police Standards and Training Council. Thank you. And doing this fully remote, I don't know how to put something up that tells people to come back at 11:30.
I'm calling the fourth floor about that right now.
Thank you, Marty.
You can sit and hold a sign, John.
Yeah, I could.
Hey, John, if I could ask you something,
Sure.
Chairman Graham.
Yeah, yeah.
I have to take an appointment between 11:45 and I should be back by 12:30. So I just want to apologize for that.
No problem. I'm not sure how long Police Standards and Training will actually take. They only have one request. And then we'll be breaking for lunch for a longer afternoon.
Okay. All right. Sounds good. Thank you, John. Nice to see so many of our members today.
The proof will be when we get to our work sessions later in the next couple of weeks and the exec session, which will be critical. I assume I'm thanking Brad for doing this.
Why is this not coming up? Ladies and gentlemen, can you hear me? This is Director Skipper.
Yes, we can. You'll be seeing the video in just a second.
Okay, all right. I didn't know if it was a problem on my end. Sorry.
You ready to go, Mr. Chairman?
Yeah, I think we ought to try to get people back. And we have about 1 minute before we get started back. I just want to give everybody a heads up that we're about to start.
I am back, Mr. Chairman.
Mr. Chairman, this is Representative Kalansky.
Hi, Ben.
Hi, I just wanted to let you know that I actually have a job interview at 1 o'clock that I'm traveling to right now. So I will participate as long as I possibly can, but I will have to log off to do my job interview.
That's fine. As you know, these are being recorded and you can catch up on YouTube or that way so that you won't be able to completely miss out.
Yeah, I planned on after my interview trying to log back on if you're still going and then catching up later on YouTube with what I missed while I was off.
When you look, our last presentation is at 2:15, so we'll probably still be here.
Okay, thank you very much.
The time being 11:30, I call the Public Works and Highways Committee back into session. And our next presentation is from the Police Police Standards and Training Council. And I believe the director is on with us. Welcome, Director. Go ahead.
Thank you, sir. I apologize. My video is not working, apparently. Can everyone hear me?
We can hear you.
Excellent. Yeah, it appears that the problem's on my end, and I apologize. So I'm going to just begin. Chairman Graham and committee members, thank you very much. For the record, my name is John Skippa, and I am the Director of New Hampshire Police Standards and Training, and I'm presenting two capital improvement project requests. In the first request is titled the AC Replacement Project, and the second one is the Range Ventilation and Filtration Upgrade Replacement Project. In this request, we are asking for authorization to spend up to $190,000 to be paid by the general fund to replace 8 AC units installed in 1983. And an additional $400,000 from the general fund to help us address range ventilation and filtration upgrades and replacements. The New Hampshire Police Standards and Training is an independent executive branch agency governed by the Police Standards and Training Council, and we're established under RSA 106L. I report directly to a 14-member council, and it is their job to set the rules for hiring and educational standards for every single police officer in the state of New Hampshire. As of June 15th, 2020, there are 3,118 full-time police officers, 1,151 part-time police officers, 428 corrections, and 78 probation parole officers that we certify here in the state of New Hampshire. We historically conduct 3 16-week full-time police academies every year, 2 14-week part-time police academies, and 3 9-week corrections academies each year. We are also the prime source that provides in-service training to all incumbent officers. In fiscal year 2019, the council offered 55 different in-service training courses and 12 online courses. The services that we provide are delivered with the help of 21 full-time and 5 part-time employees, which include law enforcement training specialists, who are police officers that are responsible for the actual delivery of training, as well as clerical staff and building maintenance employees. Our staff is assisted by a number of volunteer adjunct instructors and a small number of contracted instructors. We operate a 77,000 square foot training facility located on 20.87 acres of grounds across from NHTI. Let me speak to the first project titled AC replacements. The AC replacement request is to replace 8 air conditioning units installed in 1983 and which cover several training areas inside of our building, to include a Virtua simulator, computer lab, a number of training classrooms, and a number of staff offices. The replacement of these units with modern efficient units will greatly reduce our energy consumption, reduce system maintenance costs, and will move the agency towards the goals of reduction of fossil fuel and cost reduction set forth in Executive Order number 2016-03. This project will decrease the state's utility consumption. The second project is the firearms range ventilation and filtration upgrade replacement project. The firearms range ventilation upgrade and replacement project is for our indoor firing range, which was installed in 1992. Our firearms range is used to train all full-time, part-time, and state corrections academy recruits, along with several in-service firearms classes that we hold annually. After 28 years of continuous usage, the range ventilation and filtration system is showing signs of fatigue, and the filter frames are warping and sagging. The ventilation system must work at peak efficiency and effectiveness, as it is a life safety device that removes dangerous and toxic particles from the air during firearms training with live ammunition. Further, the range ductwork located at the back of the range, which culminates on the tactical center roof, is weather damaged and is causing leaking to occur and damage to the ductwork insulation. It is unknown what the extent of the suspected deterioration of the fan motors are. With the upgrade to a more energy efficient ventilation and filtration system and possible revamp of the variable frequency drive controls, it will ensure that this life safety device is running at peak efficiency and help with the agency goal of reduction of fossil fuel cost reduction set forth in that same executive order. This project will also help decrease the state's utility consumption. I thank you for your time and your consideration, and I stand ready to answer any questions that any member might have.
I will jump in at the very beginning because I'm sure several others have got the same question. At the very beginning of your testimony, you talked about 190,000 for the AC units and 400,000 for the range ventilation and filtration upgrade. In the governor's proposal and in the HB 25, those figures are 475,000 for the air conditioner replacements and 850,000 for the range ventilation. I'm more than willing to reduce your request to what you're asking for in your testimony, but I was trying to figure out which is correct.
Chairman Graham, I deeply apologize. I believe that I'm working from a document that was produced prior to my appointment here, and it is I take the responsibility for not reconciling the numbers that are in the present budget. That's my fault, and I apologize.
Thank you. Representative Jack.
Thank you, Mr. Chairman. Thank you, Director. Some years ago, we gave you money to redo the pursuit driving range, and I was wondering, that seemed to be a safety issue. I was wondering if that got finished and how it's working out.
Thank you, sir. Actually, it's working out very well. If you listen in the background, you might even hear some squealing tires because they're using it today. So it's been working out very well for us. I do think that we are looking to just put a seal coat over the top of that project just to ensure that we can get as much life out of it as possible.
Any other questions for the director? Director, if you would like to, oh, wait a minute, Representative Mills.
Yes, thank you, Mr. Chair. So I'm still trying to figure out whether or not the request is actually for $475,000 for these units or 190. We've determined that there's a mistake on one of these pages. Which one is it?
Representative Mills, I am going to accept full responsibility for that mistake, and I would ask that my testimony reflect the numbers that are in the governor's budget.
Follow up, please.
Yes, sir.
Follow
up. Then I take it these 8 air conditioning units, which obviously are working out to be about $50,000-$60,000 a piece. These aren't window units. What kind of units are they that 8 units cost this kind of? Is this all for one building or separate buildings?
I'm looking at my plant managing maintenance engineer who's with me now, and he's telling me that these units are rooftop mounted units.
Okay.
And they are to address major spaces within the building.
Thank you.
Yes, sir.
Mr. Shea, you had a comment.
Yeah, just to help the committee out a little bit, the numbers that Director's referencing are the numbers that came in June at the governor's capital budget hearings. At that time, the governor, along with Public Works and others, will pick several projects to put in that blue book that you have. And they end up reviewing the numbers or the estimates at that time, and they come up with a new estimate. So the best number for the estimate is the one that's contained in the blue book, which is also the number that's in House Bill 25.
I was just hopeful that it had been revised again.
Not that I'm aware of. The numbers are from the blue book to House Bill 25.
Representative Edgar.
Thank you, Mr. Chairman. And also thank you for taking my question. It's kind of a general one in a way. It has to do with the filtration system or the ventilation system. Were there any tests taken which would show that there is a there's a problem with any type of violation of air quality standards at this time?
Yes or no? We do periodic testing to measure lead levels within that training space. For those who are probably not familiar with the way an indoor range functions, there is a ventilation or circulation pattern that is set up through all of these devices so that it's pulling all the air from where the shooters stand and pulling that air down towards the target so as to get those toxic fumes away from the officer shooting and captured in the ventilation system at the target end of the range. Specifically to what those numbers are, sir, I do not have those in front of me, but I'm looking at my plant maintenance engineer, and he is telling me that we do collect those numbers, and we do have those numbers available if anybody needs to see them.
If I just do a follow-up?
Follow-up?
Yeah, I wasn't necessarily wondering what the values were. I just wondered if there had been tests taken and if there were violations, and that was one of the reasons that you wanted to replace the system. That's all. It sounds like your project sounds like a good idea. I was just inquisitive that way. Thank you.
Yes, sir.
And that was a question, wasn't it, Representative Edgar? Any other questions of the director or police standards and training? Seeing none, thank you, Director.
Thank you, Chairman, and thank you, ladies and gentlemen. I appreciate your time.
For the committee, it didn't take the half hour that I had thought it might. Our next presentation is not until 1 p.m., and that is the Department of Natural and Cultural Affairs. So the committee is in recess until 1 p.m. unless somebody has a question or comment of me. Seeing none, the committee is in recess until 1 p.m. Thank you all.
Hi, Mike. Mike Edgar.
Jim, you talking to me?
Yep. And Mike Peterson. Thank you.
Hi, nice to see you live and in person.
Yeah, thank you guys for your concern.
Well, I was thinking about you. We kept noticing you weren't at the meetings, so I thought I'd send a little note to you.
No, I'm just at the point where I'm trying to get rid of all the medicine they gave me. Get out from under it all, you know, it's crazy.
Yeah.
Why kids would take drugs is beyond me. It's scary, some of these drugs.
Oh, yeah.
Yeah, so.
Yeah, looks like a couple mics sent you a note, Jim.
Thank you.
Oh, more than one Mike sent a note to Jim.
Oh, yeah. That's what it sounds like. Yeah. Hi, Mike. Hi, Jim.
And Sue Newman was wondering, how's Jim Fadolfi these days?
Well, I'm alive.
Yeah.
Good.
Looking good.
And
how is your wife doing?
She's actually a lot better shape than I am now. She had a rough time. And she's doing well now. They give her a clean bill of health. We'll keep our fingers crossed because we still don't. Don't know why she fainted those times. And
the committee is in recess. If we could stop the recording, please.
Anyway.
So Jim, good to see you.
I miss-
Talk with you
miss
later.
all You guys, but, some of these drugs they gave me, I would hear people singing.
Very potent.
I heard a brass band playing the Star Spangled Banner. I know,
Hopefully you weren't hearing the angels.
and it was just crazy. I mean, I've been able to get rid of 2 of the drugs, and I'm working on the last 2. So, but I guess one of the last 2 is a nasty one. So,
Well, you sound lucid and alert, and that's a good sign.
oh yeah. No, this operating all this computer stuff though is.
You have to master that mute button.
And I got new stories for you, Peterson, about Subarus. I got another Subaru. And
Which kind of Subaru did you get?
I got the next one up. Outback.
Oh, that's a great car. Highly ranked,
And
highly rated.
And the whatchamacallit, the cruise control also keeps you in the center of the lane.
Yeah.
You take your hands off the wheel and it drives down the road, makes the curves, does everything. Then it flashes a big red light. Put your hands back on the steering wheel.
No kidding. Well, these cars are getting to be really smart. It keeps you in between the white lines.
So it's quite interesting.
Well, good luck with that new car.
I'm going to sign off and have some lunch.
Yeah, I'm going to go have some chicken.
Yeah.
Jim. Oh, he's gone.
Yes.
Rep Mills, can you hear me?
Yes, I can. I can hear you.
Okay, thank you. I was just trying to fix the problem that made it hard for me to respond to the roll call this morning. Thank you.
Okay, no problem. You got it.
We will resume in just a couple of moments at 1 o'clock. I'd like to call the session of Public Works and Highways back into session. The first presentation that we have this afternoon is from the Department of Natural and Cultural Affairs, and I believe the commissioner is already on.
Hello, can you hear me?
Yes, we can hear you. And you
Wonderful.
have with you,
I have Tom Mansfield with me to my left, and I have Director of Parks and Recreation, Phil Bryce. And our Director of Forests and Lands will be with us in a moment. And also on our screen, you'll see Chris Marino, who is with us as well to answer questions. Here comes Patrick. So we're all
just one moment, Commissioner. Mr. Shea.
Thank you, Representative Graham. During the lunch hour, I emailed a new presentation from the department to all the members, and we've updated that on our website. There was just a couple of slides that they needed to have added to that original presentation I sent to you. So I just wanted you to know it was available.
Thank you. Okay, Commissioner, you ready?
I am more than ready. I will start with a few remarks and then we'll open it up, okay?
Okay.
Thank you for having us today. It's an honor to be before you to present the Department of Natural and Cultural Resources capital budget request for the 2022-2023 biennium. This is just the second time that DNCR has presented a budget, as it only became a department in July of 2017 when Governor Sununu took advantage of an opportunity to leverage connections by merging Parks and Recreation and Forests and Lands with the State Library, Division of Historical Resources, the New Hampshire State Council on the Arts. These 5 divisions share a mission to protect, preserve, promote, and manage the state's natural and cultural resources, supporting New Hampshire's high quality of life and strengthening the experiences of our residents and guests. The current COVID-19 pandemic has only reinforced the public's engagement with the great outdoors, longing for community connections, and overall appreciation for cultural experiences. One illustration of this boom of support is our online donation button on the State Parks website. During the 2019 calendar year, Parks received $20,554 from online donations. And so far in the 2020 calendar year, Parks has received over $84,000 in online donations. We're very enthusiastic about the $4,083,000 allocated to DNCR in the governor's capital budget. While this is about $3 million less than the last biennium, the capital investments shown in the 12-year summary, in your packet have allowed us to focus on much of our priorities as part of our effort to stay in step with the ongoing need for improvements in our infrastructure that we are responsible to maintain. Safety is a top priority throughout our agency, and for that reason, we have placed our radio communications network replacement at the top of our capital budget needs. Our statewide radio network has reached the end of its life. A reliable radio system is necessary for critical life safety communications for this department and our public safety partners. We come to you with the full support of the Department of Safety, who proposed this integration solution that will allow for us to replace our entire out-of-date system instead of only half. And this will save the state money by integrating into DOS's recently installed statewide radio system and by sharing resources. The strong partnership between DNCR and DOS benefits all Granite Staters by ensuring strong interagency communication. Next on our list is the Mount Washington water system upgrade. As you know, the summit of Mount Washington is a very popular destination. A more modern, efficient, and freeze-proof water system is necessary to support increased numbers of visitors year-round. Roofing and repairs is a regular request from this department, as is toilet building upgrades. Our state park system is operationally self-funded, which means we need to attract visitors and repeat visitors in order to sustain operations. The capital investments that help us tackle deferred maintenance projects, respond to emergency situations as they arise, and provide clean and safe bathroom facilities enhances the visitor experience and supports our overall success. Before we open up to questions about the various infrastructure projects listed before you, I do want to take a moment to preview a project that will soon need our attention. The Cannon Mountain Tramway has been one of the most significant attractions in the state park system since the first version was installed in 1938. That original tramway lasted 40 years before it was completely replaced in 1978 through 1980 with the current system that we enjoy today. It's now time to start planning its next chapter to ensure the reliable and safe operation for the next 40 years. The Cannon Mountain Tramway is an integral part of our winter and summer operations within Franconia Notch State Park and is a major contributor to our overall revenue generated. We have begun the process of researching our options, and we are available to share some of our preliminary estimates and potential project phases with you today. The work accomplished within this agency plays a vital role in maintaining the quality of life that we are all so proud of. It's with the support of our citizen legislature that we can continue to ensure our public places are safe, accessible, and positioned to bolster our economic future through a robust and responsible outdoor recreation economy and a creative economy that is being recognized as a priority in communities large and small. I thank you for your time today, and I'm joined by members of our agency's leadership team, and we are ready to answer your questions.
Commissioner, if you could go over each of the projects that are included in the governor's proposal, and then we'll consider the tramway.
Great, thank you, of course. With me is Tom Mansfield, who is more than our department architect, but he has put together some specific details about each of the projects that we have outlined and that the governor included in his capital budget. So I will turn it over to Tom.
Thank you very much. The governor's budget had 4 items totaling $5,233,000, which includes some federal money, which is why that's higher than the 4,000 we told you earlier. But the first item on our list is radio communications network replacement for $713,000. The radio communication system is how a lot of our field people communicate with each other. It's an essential system for life safety situations which come up like wildfires, floods, storms, It's also essential for our daily operations. It's how our park staff communicate with one another. It's how Mount Monadnock organizes rescues. It's how Hampton Beach organizes their lifeguards. So it's an essential service, but our system was put in 1995, and that's pretty old for radio equipment. So we can't get replacement parts anymore. And it doesn't have the functional operations that new systems have. A new system is interoperable. That is to say, if I'm a lifeguard holding a radio, right now I have to call a central dispatch, and then if they need to talk to the next lifeguard down, they can relay my message to him. With an interoperable system, I can talk directly to them. And if it's interoperable between agencies, it means if I'm a park manager and I have a real problem, I can go directly to the state police, or I can get help from Fish and Game. So that's what the new system would bring us. And we think it's very important to us. Now, in the last biennium, we made a request for this same project. And we were asking for $895,000 for doing the southern half of the state. Recognize that the radio system is a big cost item, and we had split it up into two phases, southern half and northern half. We were only able to get $400,000 for this current biennium. And we haven't spent that money because, talking to our radio supplier, Motorola, there's no good way to piecemeal the system. It has to be done as a whole upgrade. So we were waiting to this biennium, hoping that we could get more funds so that we could complete the system. Now, on our radio system, we've been working closely with the Department of Safety. They have been helping us out maintain all of our communication sites, and it has really been working out very well. They looked at our proposal for the southern half of the state with us. We asked them to consult with us on it. And they came back to us and pointed out that all of our communication sites are sites that they already have equipment at, and that their existing equipment, in many cases, could accommodate what we were hoping to do with a new system. So looking at this together, we realized that if we became integrated into their system, we could really save a lot on infrastructure equipment. So we are coming back to you today with a proposal to replace the entire state system for the $713,000. Working with the DOS people, their people will do installation and help us with maintenance on it, which is a great advantage to us. And this will give us all the advantages of the new system, the interoperability. It'll bring us up to the current standards. Other agencies in the state, counties, local, are also trying to integrate into the same system so that in emergencies, we can all communicate together. So that's why we think this one is a very important one for us. And we're really pleased with the relationship with DOS, which I think is going to work well, and it's going to save us all a lot of money.
I do have a question on this. I'm glad that you're working with safety, because that's always a good thing. You're asking for 713,000. Is that in addition to the partial funding you received last biennium?
That's correct. We were asking for it to supplement the 400,000 we had asked for before, which we're asking for a lapse extension on.
Thank
you. Shall I move on to the next
Wait a
one?
minute. Representative Ebel.
Thank you, Mr. Chair. Good to see you folks again. It's been a while. So I was just trying to follow the bouncing ball a little bit. Are you saying that this money is going to replace the system for the whole state, and all agencies are going to benefit from it, and it just happens to be in your budget? Is that the way that works?
I wish it was.
Okay.
It's only for DNCR.
Okay.
So because previously we had been suggesting a two-phase project, one for the southern half of DNCR's radio equipment, and then for the northern half of the state. But we can do the whole state for our equipment under this project.
Okay, just follow up, Mr. Chair. So, but So is safety also going to be benefiting from the system you're putting in, or this really is a whole? I was just confused on the interrelationship.
Well, safety has been directed to try and consolidate all the state radio communications. And I think we're their first big taker. So in that sense, it benefits them from getting their program off the ground, and we can show how it can be done and demonstrate the benefits. It certainly will be a benefit from our point of view.
Thank you.
Seeing Representative Jack.
Thank you, Mr. Chairman. Thank you for coming. It's always lovely to see DNCR. If I understand this, you're sharing infrastructure, things like maybe the towers and the power feed to the tower, but you have your own unique equipment, maybe because you're on different frequencies than safety, something like that. Is that a fair characterization of where the synergy is?
Yes, the system has repeaters, which is equipment which forwards signals, and Department of Safety has repeaters, and we have had repeaters too. But as I understand it, and do we have Department of Safety also here?
No.
Oh, okay. Their repeaters have enough capacity so that they could handle our traffic on their equipment, because when they built their system, they intended to consolidate all the different state agencies. So they built that extra capacity into the system, and they're encouraging us to take advantage of it.
For the committee, a reminder that Department of Safety Commissioner Quinn will be on later if you want to ask him about this at that point after his presentation.
Shall I go ahead with the other items?
Representative Cloutier.
Okay, thank you, Mr. Chairman. A question, now is this, I noticed in the blue book, you only had there was only appropriated 545,000, but the governor gave you a little more, 713,000. I was curious why a discrepancy, and do you think this is going to be enough on top of the $400,000 we appropriated in the last capital budget?
Yes, I can explain that. The 455 was because that was our original request for the southern half of the state to do it on our own without help from Department of Safety.
Okay.
So once we realized we could do it with the Department of Safety, we realized we could do the whole state, but we would need an additional 713 to do the whole state and not just the southern half of the state.
Okay, thank you very much for that clarification. Thank you, Mr. Chairman.
Representative Thompson.
Must be
Unmute
muted.
yourself, Dennis.
That's better. Tom, is this system going to help with the emergency command center in the case of, a hurricane or whatever? Is that going
Yes,
to
it
widen
is.
your communication?
Yes.
And that'll be,
So Department of Safety has consoles all around the state, which we would be able to use if we needed to set up quickly. And they also have essentially portable consoles, so that if we had a situation like a wildfire, we could bring that right to the site and have the main dispatch working from that site. So that's one of the advantages of the new system.
okay, thank you.
I just learned that the Department of Safety has staff available on this call and they're raising their hands. Sean Goodman? Goodman, yeah. Goodman. I see Sean.
Welcome.
I have brought them up.
Here we are.
Good afternoon, members of the committee. Can you hear us?
Yes.
Hello, I'm Sean Goodwin, and this is Josh Mann from the Department of Safety Communications section, where we are currently at the track in our command post, getting ready to support the Super Vax event. And everything that you heard from Tom Mansfield and the commissioner is accurate. Essentially, all of the dollars that are being requested go into the physical radio resources that the NCR needs to upgrade to support all their different operations, whether it be at Cannon, Mount Washington, the Southwest, the Forest Fire Towers, and without having to spend money on duplicating things that the Department of Safety's core infrastructure already supports.
Thank you. Appreciate that clarification. Seeing no further questions, moving on to Mount Washington.
All right, our second priority was upgrading the water system on the summit of Mount Washington, which supplies our Sherman Adams Visitor Center. That the water tanks up there actually predate the Sherman Adams building. They were put in 1969. They're steel tanks and they're beginning to rust out. And because they were put in before the Sherman Adams building, they weren't set up to operate efficiently with the new system. In fact, their tanks are located some 320 feet downslope from the building. So we have a situation where our new well that went in with the building, which is right next to the building, pumps the water downhill to the tanks. And then we have to pump back up the hill to the tanks to the building. And this works well enough in the summer, but those 320 feet are open to freezing during the winter, and we keep that building operating all winter long. We have observatory, Mount Washington Observatory staff there, and we have park staff. And occasionally the observatory has eco trips that bring in a dozen people overnight. So we have water needs right through the winter. And in order to keep the building running right now, we have to shut down the summer season water system, drain it out, and set up the new season system every year. So that's a lot of extra maintenance. So where we're at a point where we need to replace main components of the water system now, we wanted to take this opportunity to really improve the system. And working with Underwood engineers, we've come up with a plan to put new water tanks, which are made out of fiberglass reinforced plastic so they won't rust like the current steel tanks. We would locate them right adjacent to the Sherman Adams building, dug into the fill behind the building towards the summit side of the building, if you're familiar with the site at all. So those tanks would be underground behind the building, but right adjacent to it. Our new system could pump right from the well into the building, route the water pipes through the building to these two new 20,000 gallon tanks, one of which would be set up with a heater and an agitator to keep the water moving so it won't freeze in the wintertime. So we would have the same water system running winter and summer. And that would be a great convenience to us. And we don't have to go through all the testing for a public water system every time we change over. So it's highly desirable for us to get this accomplished. We thought that that would be, well, our current ask is for $1,020,000 for it. There's quite a bit of site work, and any piece of work on the summit of Mount Washington is complicated and expensive, as you may know from previous requests. Could I answer any questions on that one?
Seeing no questions.
All right, our number 3 request is for roofing and repairs. This is a group of projects that we're requesting money for: roofing repairs and deferred maintenance required to keep our state parks open and other state parks and other DNCR facilities operating and providing services. It's a source of funding to allow the department to respond to critical facility failures, things like water and septic pump failures, boiler failures, storm damage. One year we had a big storm in April that tore up the parking lot in Northampton State Beach. We were able to get that repaired because we had money right there. We could move quickly and get that parking lot repaved in time to open for Memorial Day. So it's quite important to us. There's attached in the packet, there's a list of repairs and there's a list of roofing projects. The repairs are representative of the types of projects that we wanted to address with this funding. But we know that since we're dealing largely with situations that come up during the season that are on the emergency basis, the list is going to be subject to substitutions and revisions in order to accommodate that. That flexibility is greatly important to us. So this year in roofing, there's about $340,000 worth of roofing projects we've identified. And I'm pleased to report that we are coming to the end of our deferred maintenance on roofing. The state parks is somewhere in the vicinity of 865 buildings. A lot of them are very small buildings, admittedly. But when we started this program of roofing and repairs, which I think was in about 2026, we were hopelessly behind in our roofing. And now with this appropriation over the years, we've been able to whittle that list down so that as we go forward, it'll be all scheduled maintenance. In other words, we know that every 2 years we'll have so many roofs come up that are due to be repaired. And that should be a manageable amount that we can continue into the future. So this has been very useful to us to get this funding.
Representative Abbott for a question. You have to unmute, Mike.
Yes, just a follow-up on what your explanation was. I'm assuming that these projects will be prioritized based on need. Is that correct?
That's correct. And we recognize that sometimes those priorities shift in the course of a biennium as different situations develop and things we have to respond to change.
Seeing no further questions. Next is
our
toilet building.
Our fourth item was a request for continuing support in our ongoing program for toilet building upgrades. We have just about 85 toilet buildings or bathhouses in the state parks and other state reservations. And many of these buildings have had long, hard service. It leaves them difficult to maintain and hard to keep clean. And we know from reports we get on questionnaires that we ask of our patrons that the quality and conditions of our toilet facilities have a major effect on whether our visitors have a good experience in the state parks and whether they're interested in coming back. So we have been working on replacing any of our facilities or renovating any of our facilities that don't live up to our state park standards. In this biennium, we had 4 toilet buildings that we hope to address. And the first one was a renovation of the toilet building at the south end of Hampton Beach. We did the exterior of this building several years back when we were doing other work at Hampton Beach, but the interior is in pretty rough shape at this point. Right now, it includes a lot of shower rooms. And what we've realized is that for showers on the beach, what people really like and what works best is exterior shower pole facilities so that we don't have to have interior shower rooms, which are difficult to keep clean and hard to maintain. So we can do much better with the interior building. We can provide more toilets and we can move the shower poles outside. So that would be a great improvement at Hampton South Beach. Then in our campgrounds, we had 2 toilet buildings which we want to renovate and add on to. So in Pawtuckaway, it's toilet building number 2, which is in the Neels Cove area, if you are familiar with Pawtuckaway. These are buildings which date back to the 70s. We will renovate the existing toilet areas, add on shower stalls, what we call family bathrooms. That's private bathroom with a sink and a toilet in it, and pot washing sinks for our campers. We'll do a similar thing in White Lake, toilet building, also toilet building number 2 in White Lake, which is in the Area 1 campground. So both of these buildings would be a combination of renovation and addition. And then the 4th building was the toilet building number 3, which is on the south side of Lafayette Campground. At Lafayette, we have replaced a lot of toilet facilities, but this is the one building that goes back to the 1950s. It's pretty rudimentary and well loved, but hard to keep up, and is not really living up to our campers' hopes these days. So we would propose replacing that building altogether. And that's the 4 toilet building upgrades that we had hoped to do. Can I answer any questions on that?
Representative Jack.
Yeah, thank you again, Mr. Chairman. The fact that these are listed with very general things like toilet building repair or roofing means that you can spend the money on whatever projects you want within the limits of the money you have, and this is sort of informational that you're giving us what you'd like to work on. Is that right?
That's correct. So these are certainly the priorities that we want to address, but sometimes we might get stopped on one toilet building or another one. There could be a problem that comes up, and this would allow us to continue in the same category, but move on to another building until we can resolve whatever the holdup on the previous one. For example, at Winslow, we have in this biennium a request for redoing that toilet building there. What we've realized is our water supply is not good enough. We're waiting to drill a new well to see whether we can get a water supply. If we can, we'll go forward. If not, we'll try and use the funds in the other toilet buildings that we had asked for in that biennium.
Representative Ebel.
Yes, thank you. So this looks like it's a 50-50 match with Fed funds. Is that, we've been reading a lot about LWCF. Is that the funding and what's going on with all of that?
That's exactly the funding. The commissioner may be more up to date than I am with the current state of LWCF funding, but that's the funding that we can get a 50-50 match for on projects like this, which allows us to extend our capital dollars quite a bit.
Yeah, and you probably have seen a lot of recent news about some changes made to the LWCF fund. The previous administration made a few changes, and it was sort of revealed to the public in January. As soon as we all of the states noticed these changes, we asked our governors and our federal delegation to please help us reverse the changes to go back to how we've always operated under LWCF. And that was successful. So we are back to how it's always been run. And we feel very confident that those funds are readily available and that we can use them in this way.
Follow up, Mr. Chair.
Follow up.
Okay, thank you very much. I was really glad to see that reverted back to the way it once was. Since you went ahead and mentioned Winslow, were you saying that if you can't get adequate water, you're not going to follow up on the toilet building? Or I didn't quite follow what you meant there.
I would never dare suggest such a
No.
thing, Representative Ewan. We will look into composting toilets if that's the case.
I see. Well, I know a lot of people that would like to have the toilet building.
Follow up.
So that's why. Follow up. Thank you.
Commissioner, just a point. You handed out the slides and it says toilet bowl building upgrades for 2.3 million. I know it's only half that, but when somebody just picks up a piece of paper, they think it's the whole thing. I would just break it out on all of your slides between the two sources of funding so that people actually know what we're doing.
Thank you, we will.
Any further questions on what the governor has proposed and we've been talking about? If not, Representative Ebel.
All right. Well, I don't comply actually with your request because it's not in the governor's budget, but with your forbearance, I just like to ask if any LWCF money could be used for the Cannon Mountain upgrades at some point, or doesn't it fall within the right category?
We're going to talk about Cannon Mountain now, and maybe they can answer that question as they go through that. But looking at the dollar amount on Cannon, you've got a hard sell.
Yes, I recognize that, Representative Ebel, the short answer to your question is yes. LWCF funds could work to support this effort. The reason I felt compelled to bring this before you today is because I wanted to give a heads up about the future needs at the Cannon Tramway. I'm not expecting a magic wand today to fix the tramway, but I feel like this shouldn't be something that is just sprung upon you with a rushed need. So I wanted to make sure that this committee was well aware that we are starting to do our research and come up with a plan and a proposal so that our state can figure out how to move forward and support the Cannon Tramway. And so that's really why I wanted to put it in front of you today. I'm sort of taking advantage of your audience right now to make sure that you have time to think about this, that we have time to answer your questions, and that we can think creatively about how we can sustain such an iconic piece of New Hampshire moving forward. So, so that's why I put it in front of you today.
Okay, let's go ahead and go through it briefly. And I'm sure that there may be some questions.
Great. I'll turn it to you, Tom.
Yes, the existing Cannon Tramway was installed in 1978 or 80. We're coming up on 40 years. And we had one of our regular series of inspections that's done by the manufacturer on a schedule where they check the condition of the tramway in 2018. And they advised us that it was time to start planning for the replacement of the tramway. It just, at 40 years, we're sort of at the lifetime of it. One of the most significant problems is the electronic controls. Being a 1978 vintage, they're controlled by floppy disks. We can't get any replacement for these controls if they should fail. So the way the tramway works is that the controls, the brake hydraulics, the carriages, the hangars are all part of an integrated system. So the guts of the tram that are actually moving transportation tram all need to be replaced as one unit. Our current estimate for what that would cost if we were to do that now would be in the $6.5 million range. So that has to do with motor, drive, brake hydraulics. It's the tram cars and their hanger arms. It's the carriages that run on the cables, the gearboxes, all the equipment for tracking the ropes, the haul ropes, the bull wheels, and the labor that goes into it. So it is a big package, and that much, it's going to be hard for us to break that down into phases. I think if we get to the point where we can do this replacement, we would want to plan to do that as one unit. Other items that would go along with a big overhaul of the tramway would include painting of the exterior steelwork in the tramway bays. If you're familiar with the tramway, the bays are 40 feet high, steel structures open where the tram cars go in and out. The steel in these things has rusted out very much like a steel bridge would rust. And we need to grind down the rust on that and get it repainted. We actually went out to bid to get that painting done, not being aware of how complicated a process this was. We had a budget of $250,000 and our low bid was $1.8 million. So that bid was high because we had asked them to allow us to continue operations while they were painting. I think maybe we would reconsider that in another time out, but it is a big number to get that steel work in good shape. Then we have the tramway towers. There's 3 towers that support the cables up the mountain. The towers we have inspected visually, and they're actually in pretty good shape. But we need to, after 40 years, we need to have structural engineer actually go up, check the fasteners, make sure the steel isn't compromised. We know that there is some minor work to be done on the foundations with the regrouting. So that's an item. And then, of course, we have the lodges. We have the lodge at the base station and the mountain station. And those are all the same vintage. Well, the one at the bottom is actually older. but they had major work last done in the 80s, and they're really showing their age and their wear. The exterior of the building needs to be sealed up. That's the siding and the windows. And the mountain station, we have the roofing that needs to be done. We need a new sprinkler system in the base lodge. And there are just interior renovations to make our new tramway system look like a new system and not like one that's 40 years old. All the interior finishes, carpeting, ceilings, lighting, all that sort of stuff, for which we put in an allowance of $500,000 for each one of the lodges. That brings us up to a total of $12,225,000 as our current working estimate. And as we know, that's a big number, and we're working on it. We could do the base station renovations as separate phases. That would be one way to spread this out and maybe ease the pain of doing such a big project. But we know this is coming, and that it would be a shame if we couldn't get this into shape before it actually failed on us and we had to shut down the tramway. So that's why we're trying to get a jump on it.
Thank you. Representative Abbott for a question.
Yes, thank you, Mr. Chairman. I just wanted to ask the question. When you talked about these controls with the floppy disk, have you consulted with the DIT on this?
I believe that the Canon people have. I don't know that for sure. I think that they pretty much throw up their hands. For a long time, we had one electrician at Canon who was able to keep the system running. So that's how we've gotten by so far. He's now retired.
Representative Faulkner.
Yes, thank you, Mr. Chairman. The question is, I don't know if you have this information available, but could you explain us the difference between ridership in the summer versus winter? And if you have the information about how that serves New Hampshire residents versus people from other states, I think that might help us understand.
Thank you, Representative, and thank you for catching the fact that it is important to us in several seasons. I'll turn to Director Phil Bryce, who oversees the state park system and can speak a little bit more specifically to our ridership at the tram.
Yes, good afternoon, Mr. Chairman, members of the committee. Philip Bryce, Director of the Division of Parks and Recreation, DNCR. Good to be in front of you again. 2 years goes fast. We will get you the details on that information. I don't have them off the top of my head. All I can say is one thing you should know is that the ridership in the summertime and the revenue in the summertime is actually greater than what we get in the winter season. So it's really not it supplements the skiing experience because it gets you quickly and sheltered in high winds to the summit in the wintertime, which really is nice on those cold days. And then you can have a wonderful run down the mountain. But really, it's an integral part of our summer and fall experience, which is why Franconia Notch is rated anywhere between 2, consistently on a regular basis, one of the top 10, 20 state parks in the US. So it's one of those experiences along with the Basin, the Flume, Echo Lake, and the other hiking and offerings we have there, including the camping, of course. So I will get you those numbers, but the important thing to recognize is that it really is a major summer what do we want to call attraction. Regarding winter, regarding out of state and in-state use, generally across this park system, we see about half of our visitors based on some studies, but like in Monadnock, it's 80 to 90% out of state. So I anticipate that it would be a high number. Whether or not we track that or able to know what that number is, I don't know other than anecdotally, but that's why I need a little bit of time to dig into that a little bit further. So
Representative Thompson.
Commissioner and Tom, the $1.8 million to paint inside those buildings. And correct me if I'm wrong, is that not steel paneling like you would build a steel building out of?
So we're talking about the tramway bays, right? And
Yes.
they're sort of halfway between interior and exterior because it's open to the outside. And the steel frame is exposed, and that's the part we're talking about painting. And then you're correct, the siding on that is pre-finished steel panels, which are not in such bad shape, but they're fastened to the steel frame.
Follow up, Mr. Chairman.
Follow up.
So part of the painting is not the steel panels, it's the superstructure?
That's correct. Yeah. And there's railings and things like that that are also need to be painted, but the main part of it is the steel frame itself, which is rusting badly and needs to be ground down and reprimed and repainted.
Okay, just seems like a lot of money for paint.
It is, and I think there again, that price I told you included trying to do the work while the tram is operating, which on further reflection, we realized that would require quite a bit of secondary construction just to protect our visitors, walking underneath people working up above with grinding equipment. That's a lot to ask of a contractor, and I think that's why we got such high numbers.
One more follow-up, Mr. Chairman, please. Are you going to, do you anticipate the tram is going to be open this coming season because of the pandemic?
We don't have a date for when we can open it at this point now.
Okay, thank you.
Representative McConkey. Unmute yourself, Mark. Mark. Representative McConkey, unmute yourself. There you go.
Now I'm with you, Mr. Chairman. Thank you for that. I have a couple questions. So if the tram goes down in the during your winter operation, what percentage of your skiers, what would that cut you back? I imagine there's some other surface, some other lifts that get you there, but if you're down during the day, how much of your operation is hindered?
So our tram right now is closed due to COVID. We can't cram people into a closed tram car right now because of health concerns. So we're operating Cannon without the tram this winter, and operations are great. I don't know if the director wants to add anything. You can get to those trails using other lifts.
Okay.
I think I've heard
Well,
I was going to say 20%, but
20%. Thank you.
Again, I can get that. We can get that in. We weren't sure how far you all are going to go. These are great questions, and we've already started working on answering this level of detail. But of course, our focus this winter has been providing a safe experience for as many skiers as we can. And we've been a little short-staffed up there. So like JD is out running lifts and those sorts of things. We're sending staff from Concord to go up to help with the lifts. So I apologize. Usually I like to have these answers in advance, but we just haven't been able to get that together. So what I would say is that over the long term, it changes the desirability to ski at Cannon when you don't have the tram. There's a big difference between running up the outdoor lift. On a nice day, it's fine, but running up the lift and then you get off that lift and then you drop down to a second lift at the summit to go up through. Very, very wonderful, beautiful experience, but it can be very cold, as opposed to standing in a sheltered tram for, I don't know, what is it, how many minutes? Does it take? 7 minutes. You're talking quite a different experience there. So I think what it does is it impacts the overall experience in the wintertime. So yes, the answer is yes, in the wintertime. Could you get by? Is there other ways to the summit? The answer is yes, there are other ways to the summit. Although if that lift goes down, which does happen, it's nice to have an alternative to get people because skiing the top of that mountain is absolutely unreal. It's the summertime and fall that where we can't really replace that experience in the same way.
Commissioner Quinn, we'll be right with you. We're running a little over, as you figured out.
Oh, no worries, sir. Thank you.
Representative McConkey, you had a follow-up?
Yeah, thank you, Mr. Chairman. Just to finish up. So you have a 40-year-old method of transportation to get people to the top of the mountain. Have you, and you don't have to tell me now, you can get back another time. I don't like to delay Commissioner Quinn. What's the price to start afresh with something that's more efficient, hauls more people or less number of people, but new?
We have some preliminary numbers. In the 40 to $50 million range. If we were to switch over to gondola cars, for example, that means all the infrastructure we have built for the tramway couldn't be reused for the new system like that. So it's a big jump to do that.
Okay, thank you. I'm finished, Mr. Chairman.
Representative Thompson.
Just a quick question. What's the economic effect of not having that tramway running during the winter season? I don't know what it costs for a ticket there, or if there's additional costs to go up the tramway. How much money are you losing by having that down? And
good question, Mr. Chair. Again, it's hard to say when we won't know till we see that impact of fewer people skiing Cannon. And that's why we'll get the numbers on the number of people that we feel that are using that tram in the wintertime. In the summertime, I think it's somewhere around $1.5 million or more in terms of revenue. So that we would lose. So, but I'll confirm that number as well.
all right, thank you very much.
Representative Faulkner for the final question on this subject.
I'm going to pass. Thanks. I got
Thank you, Barry. Commissioner, thank you. You've given us a lot to think about the tramway. I do have one question. With the age of this tramway, is it impacting on our insurance costs for continued use?
Chris Marino, is that a question you can answer right now, or can we follow up with that information?
Follow up.
Okay.
Happy to do that.
And again, thank you. You have anything final you want to add, Commissioner Stewart?
I just really appreciate you listening to our heads up today and your consideration for this list of projects. Thank you very much.
And thank you for being here. Our next presentation, moving right along, is from the Department of Safety, and Commissioner Quinn is already with us.
Well, good afternoon, Mr. Chair. Can everybody hear me all right?
Yes.
Great. Well, my name is Robert Quinn, and I am the Commissioner of the Department of Safety. I'm happy to be presenting for our capital budget request to each of you here today. And I just wanted to share with you that I'm alone in my office on the 3rd floor, and joining me is the Director of Administration, Steve Lavoie, who's down on the 1st floor in his office. So for the 22-23 biennium, the Department of Safety is requesting funding for just one capital project. This project will upgrade the technology and operations at the State Emergency Operations Center, also known as the EOC, which is located in the Incident Planning and Operations Center, commonly referred to as the IPOC. And that's on Smoky Bear Boulevard. The Emergency Operations Center is activated during natural or man-made disasters and serves as the hub of New Hampshire's emergency response. When activated, the EOC utilizes the Emergency Support Function, ESF structure, to coordinate a federal interagency support for response to the incidents. This system promotes an effective response utilizing all available state, federal, and nonprofit volunteer partners and resources to assist. On March 13th of last year, as many of you know, the EOC was activated in response to the federally declared disaster from coronavirus and COVID-19. Since that time, a unified command structure was established to oversee all of the ESFs, staffed by individuals from across different state agencies, including the Department of Safety, Department of Health and Human Services, Department of Administrative Services, Department of Information Technology, and the New Hampshire National Guard. Levels of activation have varied throughout the response. This $750,000 capital request is for upgrades to the technology and overall operational functionality of the EOC. This project will ensure that the EOC is ready to provide an effective, coordinated, and data-driven response to disasters in New Hampshire. Now I would like Steve Lavoie, who's joined us, to go into a few more details on the different facets of this project. Good afternoon, Steve, and thanks for joining us.
Thank you, Commissioner. Good afternoon, Mr. Chair, members of the committee. So as the Commissioner noted, there are three components of this request. There's an audio video controller display, the technology integration into our conference rooms and planning rooms, and then also furniture functionality upgrade. And so the first phase of this would be to upgrade the existing technology within the audio video controller display. The current video display was installed in 2007. It's now obsolete. We've been maintaining this to the best of our ability, but the reality is that technology has changed since then, and the volume and the quality of the digital information that we have available to us and that we need during emergency response just can't be handled by the current system. The controllers are shown here on the top picture. You can see that this entire section has to do with the processing the data. And then this is the computer screen that we use to control the system as a whole. So the current system is a 3-screen, 3-projector system. These are the 3 projectors shown here in the middle picture. The screen itself, the screens are up here on the opposite wall. As I mentioned, those projectors have limited ability to process current digital video and audio, and they've become unreliable. We actually had one of the projectors fail in the early months of our COVID-19 response activation, which required us to scramble to purchase and install and reconfigure a new piece of equipment in the middle of a disaster response. The picture quality, which you can probably tell from this photo here, is not high definition. It makes it difficult to see fine details in some of the data. And it's also very, it's very faint. So depending on where you're standing within the room, it's difficult to see all the data that we'd like all the different support functions to have access to during their response. So obviously upgrading this video controller and the screen package is important to make sure that we can continue to provide the real-time data that our emergency response teams need when responding during an emergency. The second part of this project would integrate that audio video technology within all of the other conference rooms, as well as some other areas outside of the IPOC that we use for coordinating resources across the state. So that includes the situation room within the IPOC, the governor's office within the EOC, all the call center rooms, various meeting places within the IPOC, including the HSCM library, but then also integrating with the National Guard Distance Learning Lab and Joint Operations Center, which serves as one of our COOP locations. Also Newington, office space in Newington we have related to our shared responsibilities over Seabrook response, and then the Commissioner's office here at the Department of Safety. And it's important that all these areas have access to the same level of data because really the responsibility at HSEM is to coordinate our statewide resources for a coordinated response. And so conference calls and videos of meetings and leadership level planning all happens at various locations, and they all need that same data that's being broadcast onto the EOC wall. And so these upgrades would allow us to do that. That's a gap that we currently have in our response. So people are limited to what they can access based on who's in the room and what permissions they have at that point in time. And then finally, the third phase of this project would be to upgrade the furniture and the functionality of the furniture within the existing SEOC. So currently, there are 38 workstations that have been set up, each of them designated for a certain emergency support function. So these functions might be, there's one for transportation, there's one for health and medical, there's one for military support, cybersecurity. So each one of these emergency support functions has a dedicated space, and you can see a picture of the entire space here with all the different workstations. And here's a close-up of what each one of those workstations looks like. These have met our needs up to this point, but the COVID-19 pandemic brought forward some of the limitations that we have here, one of which being concerns related to social distancing and more flexibility in these seating arrangements. And so more modular furniture would allow us to better respond while also maintaining social distancing if there's another type of a public response that requires that type of response on our behalf. Right now, the other challenge that we have with this setup is that it's common for us to coordinate between ESFs, and these furniture pieces don't allow us to be more modular and allow us to combine where we maybe we need 4 ESFs to be working on a single project for 3 days out of the week, but they're located at different locations across this room. Now we have to rely on conference space. And again, we're talking about you go into the conference space and you lose access to some of the data. So modular furniture will allow us to better respond and coordinate between our existing folks within the EOC when it's activated. So that the sum of those 3 projects, which we would phase and implement in that order, is $750,000. That's the total of the requests that we're asking to be funded in the 22-23 budget. And we'd be happy to answer any questions that you might have.
Questions, Representative Jack?
Thank you, Mr. Chairman. Thank you, Commissioner, for coming. Am I correct that the EOC has basically been continuously activated for almost a year since that day in March that we all remember when we came home from the lockdown? Really a dramatic difference from the way it used to be used, where it would be activated for a few days for something and then sort of shut down?
Well, actually, yes. So the first part, you're correct in the first answer. We opened it March 10th. They have taken, here and there a weekend off, a couple days, but it's primarily been 7 days a week. And but depending on what the disaster is, kind of drives how long they stay open and to what. I mean, we've had some significant ice storms which had extended EOC operations 24 hours a day. But no, to your point, this has been the longest run ever in this. March 10th, we opened it up and they are continuing. And also the EOC has been utilized, not only on COVID, but other events like the protests we've had and other issues, other storms and whatnot. So yes to both questions.
Representative Abbott?
Thank you, Mr. Chairman. And thank you, Commissioner, for taking the question. We heard earlier from the Department of Natural and Cultural Resources, that this system could accommodate their emergency response systems. And I just wondered if it would be, I mean, how big could it be? I mean, besides just the natural resources and, I mean, how big could the technology and operations upgrade accommodate other departments?
Well, it does now. I mean, so this serves the entire state. So if there was an issue that impacted DNCR or DOT or any area in the state, that's what it does. So this upgrade here will have the capacity to meet the needs, web EOC, the video streaming. So no matter what the event is, this technology is required. Does that answer, sir? So yes, this will, if there was any issue that DNCR required, there was a disaster that.
I think he's asking about the radios.
DOC would be activated.
Representative Ebel.
Thank you, Mr. Chair, and thank you, Commissioner. I was just curious what portion of your request was the furniture? And then I have a follow-up.
Steve, do you have the breakdown on that?
Yeah, I can answer that. So I mentioned there were 3 phases, and obviously these are estimates, but we were estimating breaking that up evenly. So we've got 250,000 for each section. That would include the furniture. If that might be a little bit conservative of an amount, but we want to make sure that we do this right.
Follow-up, Mr. Chair.
Follow up.
I just wondered in general if you consider furniture a capital investment or is it more operations?
Yeah, I think it depends on the situation. That's a good question. In this case, because of the specialized nature of this furniture and the use in this capacity, we would treat it a little bit differently than, say, an office set for an administrative position within a different area of the department. So in this particular application, we are treating this more as equipment than necessarily a desk and chair set.
Yeah, and that's a great question, Representative Ebel. And I just to add to it too, I think it is important to tie it into this project only because where they sit, how they're situated, the equipment that ties into those workstations, it all kind of has to be pulled together to make sure that it that the investments we have in number 2, line up with the people that have to man the EOC.
Thank you.
Commissioner, on that, I think it is better to have it under one. I remember one of your predecessors when we were first developing and staffing and equipping the EOC, he went out and made every department cough up money to do their own portion of the EOC. And I think it caused some problems with compatibility and the rest. So I think it's better to have it all under one roof, one project. That's Graham talking, not necessarily the gospel.
Yeah, well, I'll tell you, I've learned a lot, by going out and talking to employees, and one would never imagine how important the correct chair is to a 911 telecommunicator who has to sit, you know what I'm saying, or our dispatchers. So it is a piece of equipment that, as a cruiser is vital to, the state troopers, the equipment for our dispatchers and folks that have to man the EOC, for extended periods is important. But thank you for the support with that.
Any other questions for the Department of Safety? Seeing none, Commissioner, thank you for appearing. And do you have anything you want to add at the end here?
No, I don't. I'm just glad that you welcomed our folks from the Division of Emergency Services Communications that have been working closely with Commissioner Stewart and Dancer on the radio project. So thank you for including them. And And thank you for all you're doing with your service and the capital budget.
You're welcome. All right, for members of the committee, we have about 10 minutes before we hear from the community college system. So we will stand in recess until 2:15. Thank you all.
Thank you.
Hi, Shannon.
Hello, Mr. Chairman. How are you?
I'm doing good. We'll
That's
get
good.
started here in just a minute.
That's Representative Jack. Did you want anyone else moved over? I have a few, someone named Moore.
Mhm. Yes, please. That's Matt Moore.
Okay,
So you should see a Scott Field.
I got that.
And last but not least, Ed Smith.
Oh, no.
Oh, yeah. We'll bring the big.
Oh, well, it's always good to see a former chair, isn't it?
It is. You didn't bring all the trustees?
No, that would have been a little much. And I think you all know, well, maybe not, Susan, I'm not sure where Susan Hewitt is appearing on your screen, but she's our.
Hi, everybody.
Hello.
And my thought was, if we've got Edwin Smith, who else do we need? Smokey will give us, he'll represent our
Oh,
trustees
wow.
well.
Boy, making my head big.
I don't quite understand why I'm not able to move these people.
Well, I see.
Got me in.
Looks like all our folks are here.
I don't see, oh, there's Scott, yes. Yep,
You get them all, Marty?
yes.
When we're ready to go, Susan can more formally introduce us all, but I think we're all on.
Okay. The time that I have being 2:15, I call meeting of Public Works and Highways Committee back. And our next presentation is from the Community College System of New Hampshire. And I welcome, what is your title now, Sue?
It's interim chancellor.
Okay, that's, all right, the interim chancellor.
Thank you so much.
And her staff.
Yes, very, very important people. I'm going to begin by saying I'm the recently retired president of Manchester Community College. And as the president from that place for 11 years, I want to express my gratitude to you for all of the funds that you sent to MCC. We used them well. We were able to really develop our technical spaces. If you haven't been on that college campus to see the great work, especially the most recent addition, the HVAC and electrical building, which is operating the way that we had envisioned. So thank you. And today I have with me, first I'm wearing a different hat. I'm learning in New Hampshire that retirement is not a steady state, that you end up coming back. So here I am as the interim chancellor through the end of June. So with me, I've brought my own team of experts, Shannon Reed, whom I think many of you know, who is our legislative affairs person, Scott Fields, who is our new chief of operations, and another face that I suspect is very familiar to you, Matt Moore, who is in charge of our capital projects. So we have sent you a short series of slides. I'm going to just touch on a couple of them. I'll begin by answering the first question we were asked to address, which is, what was funded in the governor's budget? In the governor's budget, what was funded was an earmark for Nashua Community College to complete the renovations to their engineering program. Having said that, you also are giving us the opportunity to talk about us and what we had proposed originally, so I'm pleased to do that. As you can see right now on the screen, just a little overview of who we are and who we serve. We serve about 26,000 students. This year, I think our youngest student is 16 and our most seasoned student is in her 70s. So we cover the gamut of ages. And we do this across the entire state of New Hampshire, as you probably know. Within, the goal is that within about a half an hour, 25 miles, any resident of the state of New Hampshire can get to either one of our 7 colleges or one of our 5 instructional locations spread throughout the state. And we are, in fact, the lowest college tuition in the state, public or private at this moment. And we function with hundreds of partnerships with businesses. In fact, we've got a few pages just to show you who it is we do business with. And maybe the most important piece is that we're here to serve New Hampshire residents. In fact, 93% of our students are from the state of New Hampshire. Next slide, Shannon. So in terms of our capital needs, we have 4 priorities. Critical maintenance, as you know, we have lots of buildings across our campuses. We're also very focused on maintaining our IT technology infrastructure. And in fact, that has served us so very well through the pandemic. You've heard about lots of the colleges and how they've had to go remote at times and then come back on campus, and they've got to do testing and so on. Our needs were a little bit different because our students are in and of the community. So our ability to support them through our IT infrastructure has played a key role. And we've continued on our way to meet the industry pathway programs. You're familiar with them probably in automotive. I was betraying my Manchester roots before. I'll also say there's a great program there, a connection with Eversource for line worker programs. You actually most recently gave Manchester money to convert a lab to continue that program. The last week I was there, they were interviewing students for the class that's currently in session, and 150 people showed up for 15 slots. So there's a great interest, a great need, and a terrific program. And finally, our focus on spending the money that you give us and others as well as we can. We really do want to pinch our pennies. Matt has kept us focused on energy efficiency as we've gone through. Again, a slide that just makes the point that we're serving the folks that are here. Shannon will go on to the next one, please. This is a slide that really I'm proudest of. We are a good return on your money. And in fact, we have national standing in the success of helping people to move by the age of 30 to 2 economic quartiles above their parents. For me as a parent, this is the proof that we are doing what every parent desires, which is to give their children a better life than they've had. And your investment in our community colleges, in fact, is assuring that we're doing that. You can see 2 examples here of national ranking, one for Nashua and one for White Mountains Community College. Next slide. A couple of other things. We actually have the highest graduation rate for community colleges in New England. We're still working at this. And if you see the national statistics, you'll see that it's 36%. But what that 36% represents is people who began first time, full time, and then graduated within a 3-year period. Our students are profoundly affected by what's happening in the economy. And in fact, people who do graduate don't necessarily graduate within the 3-year period. If they start off as full-time and life changes and they've got to go out and work, they still keep at it with us and they still graduate. So they may graduate on the 5-year plan or the 6-year plan. I make that point just to emphasize exactly how flexible we are, but also how focused we are on successful completion. And so let's go on to the next page, and we have pictures. So first we have pictures of the recent project, the HVAC project that I had spoken to you about. We also have the manufacturing lab, and the next page, you've done nursing, you've done culinary, automotive. You can see the whole range of programs that you've affected, most recently clinical labs at 3 of the colleges. So that brings me to talking about what it was we had originally put together. Our request for the FY 22-23 budget was 16.8 million. And you can see from the chart how it is we proposed, or what it is we were proposing. The first line, the 3.9 million, was in critical maintenance and safety, followed by a 2.7 million in infrastructure. And I do believe Shannon, that we actually went back and we looked at this particular number and we have a revision. If you could talk about that for a moment, please.
We have a downward revision in this request. When we initially filed or submitted the form, it was $2.75 million in total in IT infrastructure expenditures. But we found within that some items that really weren't appropriate for capital funding. So those would be, if we were able to do it, we would need to fulfill those needs from our operating budget. So we have removed that, which brings our new IT request to 2.25 million. And we have a slide that is more specific to IT, but right out of the gate, that's a $500,000 decrease in our request for IT.
And the third line is about industry pathways. I had mentioned the Nashua engineering project. The other project that would be included in industry pathways is some remodeling and renovation at Manchester Community College, basically to support Manchester's partnership with UNHM and the Army project. What is needed is some additional lab space so that the biology majors and the advanced manufacturing majors can have the opportunity to learn sort of the cross-pollination between biology and advanced manufacturing. So I can talk more about that if you have questions in a moment. The next project is the White Mountains expansion in Littleton. We're very excited about this. The possibility here, because the college has been saving funds and because of some other property that they've had that they're able to sell, we're purchasing a building in Littleton. And what we would be asking you for is for help to move the very successful diesel program to Littleton. Again, going back to when I was a president at Manchester, lots of folks that are in the heavy equipment industry said, well, can't we bring that program to Manchester? It would be more centralized for us. And as community colleges, we work together. And my answer was, we're not going to do this because it's it's a key program for White Mountains. But people were complaining about the fact that, to get to Berlin is not as easy as if you can zip up 93 North and you can go to Littleton. And so the project that we're proposing here is that you help us to add the diesel technology program to this new site, which again, I can speak about. Our final proposal is to renovate Farnham Hall at NHTI. This would be to convert the space to fine arts. Currently, the college houses the program off-site. They are looking to bring it back onto the college campus. The lease there is about $100,000 a year. So that's our whole proposal. And I'm happy to actually turn things over to Matt to speak in more specifics, or to Scott. Scott is, he's coming to us to this COO position from having been the chief financial officer at White Mountains. So we have two people who can speak in detail about the project should you have any questions about them. So thank you. What can we answer for you?
Why don't we talk about the critical maintenance first? If you could go back to that. You have just one huge number. How would you break that out between life safety, roofs, replacement of old fixtures? If you don't get the whole 3.9 million, which will be a stretch.
Sure, we understand that. It's certainly a challenging time, and we are grateful for whatever it is you can send our way. But Matt, could you talk specifically about what's in that 3.9? What are we talking about there?
Yeah, we're talking about, as Representative Graham said, some roofs. I don't have it broke down the way you've talked about it. I have it broke down by colleges, and I'd be glad to do that if, I can get that to you, Representative Graham.
If you would, please, because I think that will be important to all of the members of the committee when we begin our work sessions and executive session on House Bill 25, to at least be able to look at that And if we can give pieces, it's better than giving you nothing.
Do you have the information? Did Public Works pass along the itemized list? Because if they didn't, I can.
We'll follow up with that.
Yeah, follow up.
Yeah, because
I'm
most of
trying
our
to pull out.
most of our requests are rooftop units, electrical units, you know, and there are some roofs, but mostly a few years ago, I had consultants go through every one of our buildings and itemize every one of the pieces of equipment in the facilities. And this request is the last of the 0 to 5 years that the life expectancy of the units. And with what I'll send you is that that list.
Please do, because I'm trying to find, I don't have, and I may just not be able to have it in front of me at my house. But it's not in the book that went to the governor.
Okay, that's fine. I just so you know, the Bureau of Public Works reviewed it and they got back to me and they thought it was excellent of how I was so descriptive in what the each project was for and why it was needed. So I will pass that along for you.
Would you like to go on to
Please.
any of our other specific?
Yeah.
So Scott, do you think you can describe a little bit more of our IT elements, IT infrastructure? And these are for the kind of the central foundation, IT foundation that supports all 7 colleges. We approach the IT function as one system, not 7 separate colleges. So this investment is for a statewide impact. Go ahead, Scott.
Absolutely. Thank you, Shannon. So in the new $2.25 million number that Shannon had mentioned earlier, we realistically have come down to 7 particular buckets. 4 of the 7 are at or beyond the end of their useful life, and that accounts for 75% of the $2.25 million. And the items that you see on the screen, the VPN upgrade, our Blade servers, which are both beyond the end of their useful life. Moving our disaster recovery backup system, which is currently housed, we have a redundant copy in Concord and also one in Durham at the University of New Hampshire, but really moving that into a cloud-based form, primarily because while our copy at UNH is on a different utility network, should something happen in the Concord area, cost effectiveness is really driving people to move towards the cloud. So the amount of money that we have in here for this cloud-based disaster recovery system would essentially allow us to reduce costs long-term and provide an additional spot of redundancy to ensure that our data is kept safe and sound should something happen. Our load balancers are a key component of our internet traffic system, if you will. They are kind of buffers on the front end and the back end of the way that data flows through our sites. And what these systems do is it allows for IT certificates and things that are more technically beyond my ability to share with you right now, but it allows for the traffic to be monitored and controlled as it flows through our infrastructure so it doesn't bog down on the back end. These units are actually housed in Durham at the University of New Hampshire and are at the end of their useful life as well. We have a project with the UPS units that Shannon has on the slide here. Essentially what we're trying to do is provide another insurance policy for a lot of our technology closets at all of our college campuses and academic centers. Essentially what's happening is we have key resources in these tech closets that are either on UPS systems, which are essentially battery operated generators that will kick in should we lose power or there's a surge and acts as a protector for that infrastructure. What's there is it's either missing or outdated, or the amount of hours left in the battery, if you will. It's when you go to get a flashlight in a hurricane and your batteries have been in there for 3 or 4 years, it doesn't work very well. So what this project is doing is it is allowing us to, again, ensure these IT closets and the servers and monitors and everything that's in that infrastructure area to be safe in times of, again, power surges or prolonged outages, to ensure that there's heat in the room, air conditioning in the room, things of that nature. Our all sites ticketing system, essentially what CCSNH does is we have one help desk that is for hardware, software, facilities. And what we're trying to do is the system that we have is somewhat on the older side, antiquated, and we'd like to be able to bring it in so we can actually start tracking things that would be useful to know in this particular conversation, and that things that Matt deals with rooftop units, boilers, we will be able to track once we get the system set up and in place. We'll be able to use some functionality to track how much we're spending per unit on repair costs. So we'll know if a unit needs to be replaced because we've spent so much on it, or if there's an ongoing issue in a specific college. So maybe it's a wiring issue we need to take control of. So having that system implemented so all 7 schools and the academic centers can be on one platform, so it's centralized, we can monitor the tickets, we can track the expenses, would be a definite benefit from us on an administrative side. It would also get us out in front of ensuring that we don't have any mechanical issues or computer issues that are just, we're not seeing because we can't quantify it in one particular area. And finally, our voice system. This is something that has been part of the request, at least internally, for a while, and it's been pushed off, but this system itself is at the end of its useful life. We are tied to one particular vendor in this component with the usage that we have. So what we'd like to do is to be able to go out, get into a new system that would not tie us to any one particular vendor, that would allow us to really use our economy of scale and pull some levers to try and find some savings on the actual data usage on that system.
Question from Representative Abbott.
Yes, thank you, Mr. Chairman. I just wondered if you folks had been in communication or consultation with the Department of Information Technology regarding these requests.
Not at the time, I'm sorry, Shannon, not in the time that I've been here, but there might have been prior conversations because this budget was produced before my arrival in this role. So Shannon?
Yeah, so this year we haven't. In past years, DOIT has sat in on the governor's budget panel hearings, which happened back in the summer. So they have a lens on it at that point. And in the past, occasionally, from time to time, they've had specific follow-up questions for us. They haven't this year. Our IT environment is really not related to the states in any way. So, you know, if DOIT has specific questions or recommendations or anything that they wish to follow up on in the past, they have connected with us. That hasn't happened so far this cycle.
Okay, thank you.
Chancellor, on this item as well, you've got several items that we just discussed, but no dollar amounts to any of them other than a total. I'm assuming that the way they're listed are your priorities, but it would be helpful for committee discussions if there was a dollar amount against each of those as we go forward.
We will send that to you, Representative Graham. Thank you.
Our next request was the Industry Pathway Lab renovations, and this is what has been included in the governor's budget partially. The amount that was earmarked in the last capital budget as phase 2 of the Nashua Community College project that the capital budget started to fund 2 years ago. So that the first part, the top of this slide is funded. The second part, which is Manchester Community College Science Labs, is not presently in the governor's budget. So if you have any questions about that, actually Susan is best suited to answer them because she has a foot in the MCC camp as well. Susan, is there anything else that you want to say about that project?
I would say that the Army project has been underway for a couple of years now, and one of the needs that they've noted is the need for technicians. However, until very recently, it was primarily about the research side of things. And when we would ask, well, what do you need for technicians? Because that is the middle skill level that Manchester in particular serves, they didn't know what they needed. It's been a fairly recent discussion where they have started to identify the skill set that the technicians will need to work in the labs that Army is proposing.
Chancellor, on that, as far as equipping the lab, have we talked to Army and the investors about helping to fund the equipment that needs to go into it? I know we've done it for, diesel and automotive and dental and all the rest. Hopefully we can leverage some money from them for the equipment and other things needed within these labs.
Yes, in fact, there are two faculty members from Manchester, one from the biology area and one from the robotics area, that sit on the educator groups that are connected with Army and are well connected. I would say that the project here is actually about taking over the prep rooms that exist in at least 3 of the rooms and essentially turning them into lab space. So it's not so much about equipment as it is about constructing the space so that things can happen there. There's also a very strong connection between the faculty at UNHM and Manchester. And in speaking, in having the two faculties speak, what we discovered was that what Manchester needed to do for the students was teach them the very basic lab skills. Again, is not going to require a tremendous amount of equipment. And then there's an arrangement so that even while they're students at MCC, the students can go to UNHM and do the biotech work there. But this is a connection. The other piece of it, besides the Army part, is that there's one physics lab. And as the college has expanded into more into the electrical area, the one lab is on the smaller side of things. And again, there it is also taking over space and expanding the size of the lab. So again, not much about equipment, more about opening up the spaces and making it so that equipment in the case of the physics lab that I'm discussing can be shifted in and out depending upon whether we're talking about university physics or we're talking about environmental science.
Thank you.
Mm-hmm. If there are no other questions, I'll move on. We can of course come back to any of these. This is the Littleton expansion. The idea of expanding White Mountains Community College offerings in Littleton, basically the western part of northern New Hampshire, something that we've been talking about for several years now and had a variety of different kind of possibilities cross our planning path, and have found one that we think is really very strong, and that is to purchase the site in Littleton that we presently lease, and that's something that is underway, and then to subsequently renovate it and expand it. As Susan mentioned, one of the primary goals of this would be to bring the mobile diesel program into Littleton from Berlin, much more convenient for industry, sitting at the top of 93. That program draws not just from the North Country, but really from all over the state in terms of students, and from all over the region in terms of business partners. Very strong and important program for White Mountains Community College. If you have any other specific questions, Scott or Susan or I can answer them, or Matt.
Seeing none, has this idea been broached to the Mayor of Berlin and others that know that this may be in the future?
Yes, there have been extensive conversations between President Lloyd and the Mayor of Berlin. We're very sensitive to what's happening in Berlin, and President Lloyd has made it very clear that we're not looking to move out of Berlin. The issue with the mobile diesel program is that it's a program that requires a particular accreditation. And by moving it to this new site, or to the Littleton site, we have more opportunities. At the same time, the major program of study at the Berlin site is in the healthcare side of things. And actually, by improving some of the spaces in Littleton, we'll be able to get more people started on healthcare pathways, but then they would go to Berlin. So this seems to be a program that appeals to both the mayor of Berlin and the head official in Littleton as well. And Scott can verify, but we've had conversations going on for a couple of years with both entities because we want to keep both towns happy, frankly.
That is correct. There have been constant communications from President Lloyd. The business community in Littleton is looking forward to the possibility of this coming to fruition. And again, as Chancellor Hewitt just mentioned, we've ensured that the city of Berlin is not going to be left in a lurch. And by having this synergistic relationship between Littleton and Berlin, there will be additional students flowing into the city of Berlin at the college.
Thank you. Representative Thompson, you had a question?
I did, and basically it's been answered, but I guess my question was, how many diesel students do you have in the Berlin operation currently with a follow-up?
It's in the mid-20s.
And how many do you anticipate you're going to get if you move this operation to Littleton?
So part of the expansion of the program in Littleton is a 10,000 square foot facility that we're looking at. That would increase the size of the current location in Berlin by roughly 2,000 square feet, but it would be able to be modular in its nature. And what I mean by that is nothing is going to be permanently affixed to certain stations. So they'll have the ability to change the modality of the space that will allow for more students, as well as different programming during off-season times of the year. So I could, off the top of my head, I could see the program growing by 20%, but I don't have that number off the top of my head, and I could confirm with President Lloyd what the estimate is on that.
I will also add, Representative Graham, that the proposal to move the mobile diesel program is being heavily supported by Milton Cat. They, in fact, lent us the expertise. The company that builds all of their sites across the United States, in fact, has looked at the Littleton site and has advised us as to what we would need to construct, just to indicate the enthusiasm of the diesel community.
You had a follow-up, Representative Thompson?
Yeah, I just, $4.2 million seems like a lot of money to increase your student ratio by 20%. It's just my opinion, but I appreciate your answer.
Representative Abbott.
Yes, thank you, Mr. Chairman. I just wondered if any thought was given to, with the diesel portion of the program, to putting one in River Valley Community College in Claremont. Because it seems that I have a lot of complaints from constituents about that not having a CDL program available to them in the western portion of the state.
As far as I know, Representative, there hasn't been a conversation about that, but that doesn't mean that we cannot have one. So while the CDL program does exist at this moment at White Mountains, there had been one at Lakes Region. And we're following a newer model in the community college system where we're trying to identify, I'll call it a center for excellence. So actually, to speak about River Valley, River Valley is the place where we restarted the LPN program, Licensed Practical Nursing. And at this point, it has expanded this semester to Lakes Region Community College. And it is under discussion to expand it to White Mountains Community College. So I see no reason why we wouldn't apply that same model to the CDL. I'd like to go back to Representative Thompson's question for a moment. I agree with you that if we're going to be building, spending 4.2 million, that 20% does not sound like very much. I believe Mr. Fields is referring to the degree program. And what we are also talking about here when we talk about CDL is a non-credit certificate. And so we see an increase in short-term certificates. And now back to Representative Abbott, having the CDL program operating from one site and spreading to another site is certainly something for us to consider.
I would just add that the Littleton project encompasses more than mobile diesel program, more than CDL. The objective for that project is also to be able to expand in the array of program offerings that we currently offer in Littleton. And you can see those in the final bullet on this slide. So those include, I won't read the slide to you, but it includes a lot of additional programming in the business field, the healthcare field, general education that students in that region could take advantage of.
If I may, just to follow up to Shannon's comment, another programming option that we're looking at in Littleton has to do with electric vehicles. WMCC has actually just received a grant from a Canadian company to start exploring what that would look like. So when I was referring to the modular functionality of the space, we're able to use the space to bring in other programs like electric vehicles and things of that nature to expand short-term certificates and possibly degree programs down the road. But we've just received that seed money to start researching that particular avenue as well.
Shall I move on?
Moving on.
Okay. The final element of our request, again, is renovation of Farnham Hall. It's on the NHCI campus. We presently have about 500 students who take courses at a leased space a few miles away. It's up near the prison in Concord. These are students who are primarily taking fine arts courses, but those courses serve a wide variety of majors. So things like architectural technology, our digital gaming technology, some of the manufacturing programs that really require sort of a graphic orientation or graphics orientation. So this project would allow us to renovate a building on the NHCI campus, move all of those students back to campus, which would help us a lot and help them a lot in terms of scheduling and that just the convenience of being on a campus instead of a remote location. And it would also enable us to reconfigure that space to meet emerging program needs, because as the college looks forward, there are going to be new things that are on the horizon that it will need to offer. And this space is really where those emerging needs could be met. And we can, again, go back to any of this if there's questions, but we wanted to just kind of show you the array of industry partners that we work with. These are current or recent partners, these two slides. You can see all across the state, you can see a variety of different types of training relationships that we have, from very technical and high-tech types of training to more sort of business leadership oriented training, human services, healthcare. We really, one of the strengths of the community college system, as I'm sure you know, is that we are very well able to respond to needs and opportunities from a variety of types of employers across the state and really provide those education and career pathways for our local New Hampshire learners. So that, I believe, is everything we have brought. We're happy to go back and revisit any of these topics or projects as you would like.
Well, I'd like to make a warm welcome to the former chairman of Public Works and Highways, who's also on here, before I open up to questions. And welcome, Ed. Welcome back to Public Works.
Good afternoon, Mr. Chairman, and thank you very much. This is interesting. I wondered how these Zoom or how the hearings would go under this format. It's interesting to hear it, and I don't envy you at all. You're doing a good job, but keep it up, guys. And
Well, you
ladies,
taught me most of what I do.
What's that?
You taught me most of what I know about doing this.
You were a good student, if I remember correctly.
All right, enough. Patty, Representative Evil for a question.
Okay, thank you. And thank you very much for being here today, folks. It's good to see you. This is kind of hard. I don't quite know how to pose the question, but of course there's a lot of discussion around whether the university system and the community college system are going to be merged. Anything you want to say about that as relates to the capital budget looking ahead? I mean, I would assume that a lot of your needs would be the same. I just want to throw it open. Just as a committee, I think we'd be interested to hear what you had to say. Thank you.
Oh, that is a tough question to answer, Representative Evil, as we go through this whole process. What I will say is that, as you can see, our needs are basic and entirely tied to either maintaining the spaces that we have or creating more opportunities with industry. I don't expect, as we go forward with this, that our needs would change. What I have been saying is that, and frankly, this is a great example of an area that needs to be looked at. I'm hearing right now from our technical faculty, you can imagine that our college faculty and staff and students are concerned about what it would mean to merge. And the technical faculty have already said to me, Susan, you know, what's the circumstance in which our request for, you know, new auto lifts, for example, will measure up to the university's request for some sort of, you know, some type of heavy duty research equipment. So it is an area that we will be concerned about. You know, the impact on what we're asking for right now, there is none. These are things that we need, but going forward, we absolutely have questions about what will happen. So thank you for raising it, but we still need more information going forward.
Well, it's a tough one on a Friday afternoon, so I'm sorry.
No, you know, it's the elephant in every room that I've been in recently, so I don't mind you raising it at all. Thank you for the opportunity to talk about it.
Any other questions to the chancellor or any of her staff or the member of the trustees? Representative McConkey. Unmute yourself.
Thank you, Mr. Chairman. Thank you, Chancellor, for being here. Before I go there, I'd be remiss if I didn't say hello to my old chairman, Smokey there, and no doubt about it, well trained by you. Going back to the chancellor. In the past, and I've been away a couple of years, in the past, I've always touted about how the people you train remain in our employ in the state, raise their families, they're here, much greater than the university system. And I remember numbers somewhere approaching 90%. Has that been updated in the last few years? Do you have some idea of your census?
We do. It's at least 93% representative. And depending upon the college we're talking about, it can be 97%. Oh, wait a minute. I think I'm answering the wrong question. I'm answering the question of who comes. In terms of who stays, from what we can see, and actually we gave you a slide on that, so I'm going to actually look at it. It's slide 4. So the percent of our graduates employed in the state is about 77% overall. About 23% are self-employed, and we don't have a way to capture that, but to the point, at least 93% of the students across our system are New Hampshire residents. We think that they, certainly well beyond the 77% stay.
I would just add this,
Thank-
this data is data we derive with or from employment security. So, it's imperfect as a measure, but it captures a lot. There are certain folks it won't capture. So if people are engaged in wages that don't fall within what employment security tracks, they wouldn't show up in that dark blue bar. But the light blue bar, for instance, also includes community college students who graduate from us and then transfer on for another 2 years, maybe at Plymouth State or Keene or UNH or SNU or somewhere else. So we also, we certainly get graduates out into the workforce quickly in New Hampshire communities, but we also are a platform, as you know, for students who wish to transfer on.
Thank you for all you folks do. Thank you. Thank you, Mr. Chairman.
You're welcome, Representative Jack.
Thank you, Mr. Chairman, and thank you, Chancellor. It's always lovely to see the community college. We'll start by mentioning that I think it was last term we did go on a field trip to Manchester and saw the new building and went through all the old buildings. So that's a nice facility there. Some years ago, I was advocating for trying to get some space on the Nashua Airport for the aviation maintenance technology people so they could bring in actual airplanes to a hangar and work on them instead of being way over there at the community college. And we put a small amount of money in there for that, and it seems like it's not gone anywhere. If you wanted to comment on that at all.
I just know a little bit, and I don't know if Shannon knows. That's an ongoing concern for us. I know that President Jordan is looking at the aviation program. I'm afraid I don't know much about it. I know that the enrollment in that program has slumped. So I will put that in the category of Representative Jack. We'll get back to you with specific information about it. And I know there had been an effort to move it to either Nashua to an airport or even to the Manchester airport. I remember those conversations. Obviously, that has not happened, but I don't know much more right now other than the program is absolutely under review.
Okay, thanks.
Mhm.
Any other questions for the Chancellor or anybody from her staff about this presentation? Seeing none.
I just want to make sure I understand my homework coming out of this. We will provide you with a critical maintenance breakdown. You currently have it by college, but we'll provide it more by type of project or by project. Second, we'll itemize and prioritize our IT projects within that larger request. Third, I have a number of letters of support from Littleton area businesses and civic leaders and organizations that I'll provide to you for the Littleton project. So you'll be able to see the degree and nature of the real desire for that project to move forward in Littleton. And then fourth, Representative Jack's question about aviation at Nashua. Have I missed anything that folks will want from us by way of follow-up?
Not that I can think of, Shannon. But remember what I always tell you.
That you'll give whatever money the community college is asking for?
Yeah, that's it. But we will look at all of that. As you all know, it's always difficult to prioritize and add projects that are not included within the governor's proposal and still stay under what the treasurer suggests that we bond at. So it is a challenge, and we are up to it. And that's why we do need that additional information that we asked for to see what, if anything, that we can give to you. Because tomorrow we hear from the university system, and you can imagine that they will be asking for additional funds as well. I fully anticipate that. No, not tomorrow, next Wednesday. I'm blasted here.
Well, we also look forward to a time when we can bring you again to one of our campuses and show you the fruits of the consideration that you're able to give to us in the capital budget. It was a good tour of the HVAC area last time, and we'd like to keep doing that. We'd like to keep doing many things that right now we can't do.
And we thank you for what has been your continuous support. I understand you have a very difficult decision, and I trust that you're going to do the best you can for us to help us support our citizens. So thank you to you and to all the members of the committee for what you've done for us in the past and what you continue to do. We really do appreciate it.
You're welcome, and it is an ongoing effort among all of us over the years and decades.
Wonderful.
With that, I thank you for coming, Chancellor, and all the members of your staff. So your presentation is done. Before we close this out, I will remind the committee that we meet again next Wednesday, completely remote again. Mr. Shea.
Yes, Representative Graham, it's after you're done speaking, I'll ask you the question or the committee.
Okay.
I didn't want you to end the meeting before I got to talk.
Yes, completely remote. We will be hearing from the university system and Department of Transportation. And in the afternoon, as you will notice in the calendar, which was published last night, there is a works session on all of the agency presentations. We will begin our discussions on their requests and what we think we can do about it. It is not an executive session, but we will start to try to narrow in on what dollar amounts we are going to work with as we go forward. At some point, the week after next, hopefully I'll get either a room or Zoom time and actually have a public hearing on House Bill 25. This is the challenge of all of us, and it has gotten greater since all of the deadlines have been pushed back to the 1st of April. So all of the committees are working on rooms and Zoom time and the rest. So stay tuned for the week or two after next week. And until then, stay safe. And Mr. Shea, always listen to you.
I just wanted to let the committee know that I have a meeting with the treasurer on Monday to discuss how they account for in House Bill 2, the secure psychiatric unit appropriation, as well as if there's other appropriations, say, I know there's 2 bills in front of your committee that you have now. If they were to be passed without being included in the capital budget, how do they include that towards the recommended number, of 120 to 125 million? So I just wanted to let you know that, and then as a result of that, I can report back. Or do you want me to have the treasurer come speak to you on Wednesday afternoon briefly, just to update you on maybe how they would handle that information?
Chris, I think that if you could ask the treasurer if she could be there at 12:30 or 1, somewhere in there right after we get started, just in case any of the members of the committee have further questions of the treasurer. We won't be long with her, but it's always good to hear from the treasurer on her thoughts on what it is. I don't think it's going to change much from what she said earlier, where she was talking big numbers to change the debt ratio, but let's hear what she has to say as a committee.
Agreed. And again, I just wanted to get an accounting for you guys so that when you're looking at, how much you think you have for space, potentially, is it different if they have to include the 17 million that's in the in House Bill 2?
Okay, thank you.
In her work as well. So
anybody else? Seeing us. This meeting of the Public Works and Highways Committee is adjourned, and we will meet again to hear more presentations next Wednesday, March 10th, right in early in the morning. I thank you all for attending. I'm beginning to almost get used to these Zoom meetings.